Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, May 9th. It is Mother's Day. Happy Mother's Day to all the moms out there. Let me tell you, some people, are worried that their IC might make it, that they're not good mothers just because they have IC. Couldn't be farther from the truth. Could not be farther from the truth. Hello, YouTube. Hello, Ann. Will using a dilator cause a flare? Potentially, yeah. If you stretch yourself too much, definitely. Now, we are simulcasting live on Facebook and YouTube, but there we go. We're having a Mother's Day party in the other room. Hello, Kelly. Nice to see you. Very, very nice to see you. Awesome, awesome, awesome. Give me one quick moment. Be right back. All righty then. Now listen, I know it's Mother's Day, and that means that there might not be a lot of people on, and that's okay. If we don't have a lot of people, that's absolutely fine. Hello, Lisa. Nice to see you. Hello, Becky. Kelly says, I just found out I have crystals in my urine. Okay. So did they give you a clue as to what type of crystals they are? So crystallization can happen in urine often because you're dehydrated. I've worked with several patients. One patient in particular, very, very memorable patient for me, who had been traveling. She was traveling to Europe, and she did not want to have to use the restroom. So at least on the plane. So what she did is she stopped drinking water on the plane, and flying to Europe is a long, long haul. So she was traveling for 14 hours. When she got there, the other end, she had all the symptoms that she associated with the UTI. She just started drinking water wherever she was, Italy or wherever. But what happened on the way home is it got much, much worse. Her trip was extended. So she barely drank any water for like 18 hours. And she ended up having such concentrated urine, Kelly, that she had kidney stones. She had stones forming. Water plays an important role in hydrating minerals, and helping you pass minerals. If you're dehydrated, those minerals can end up attaching to each other and creating a variety of structures, stones. You can have kidney stones, you can have bladder stones, although bladder stones usually emerge from the bladder itself after some sort of trauma. That's when we see bladder stones. But it is an adventure. Pam says, hi, my bladder's bothering me today, and it hasn't been a long time. I think it may be stress. Yeah, stress will do it. Absolutely, stress will do it. Hey, Jan, are you guys off? Oh, that's my sister. Lisa, I've been flaring up too, probably stress as well. Hello, Donna. Hey, girl, how are you today? Nice to see you. Stress manifests in a bunch of different ways. When you're under stress, that means that your brain is changing. Your sympathetic nervous system is turned on. So we now have heightened blood pressure, heightened heart rate, and increased muscle tension, because when you're under stress, your body is preparing to flee or fight. That's a fight or flight response. So when you're tightening muscles, what's happening? You're triggering more pelvic floor dysfunction. You're also triggering a reduction in blood supply, potentially, because muscles that are tight restrict blood vessels from delivering oxygenation and good nutrition. So it's not surprising. When I go back in time and I think about the flares that I've had, the great majority of flares that I've had have been stress-related flares. And even now, even though on a day-to-day basis, I really don't have bladder symptoms at all, until you put me under stress. You put me under stress. If you tell me that I got to get on a plane tomorrow, I can tell you exactly what will happen tonight. I will have an IC flare and an IBS flare, 100%, every single time. And that is why it's so important that we work on our stress management skills and our flare management skills a little bit more. I mean, if you at least you can kind of plan for it. You got to have your routine on what you're going to do when you're under stress. You got to stop, do your deep breathing, do your mind-body medicine, your I Spy, those things like that. Maybe throw on a heating pad if you're going to be traveling, using a body heat heating pad that you can attach to your underwear that will keep your muscles nice and warm and relaxed is a really way to go. But stress is real, and we're just learning so much more now about fight or flight. Now, let me introduce myself for a moment. I'm Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the country. And I think at this point in time, pretty close to being in the world. I bring to you 3 college degrees, a degree in chemistry, a degree in drug development, pharmacology with a 1-year surgical internship. So yes, I've actually done surgery. And then I have a master's degree in psychology. I decided that I didn't like pharmacology very much. So I completely changed and went in another direction. The Interstitial Cystitis Network is my company. It is a health education company. It was my Whoa, what the hell was that? Did you hear that? Okay, that was weird. Okay, that was weird. It was kind of an electronic earthquake. I don't know what that was. Okay, so anyway, the IC Network, icnetwork.org, was actually my doctoral dissertation proposal 28 years ago. It has been rated #1 in the world by Harvard Medical School and the University of London. And I think that one of the reasons why we've done so well is because I kind of dance that dance of being a researcher / being a patient and being a support group leader. We do a lot of research on the IC network. We are the people who broke the story on the Elmeron pigmentary maculopathy. If you're familiar with that, the only oral approved medication for IC. Elmeron has now been linked to very serious retinal disease. So we played a significant role in getting the FDA to pass that safety warning that happened almost a year ago. And we are currently doing COVID and IC studies. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to tell you that this is all in your head. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that you're stupid. I don't want anybody ranting on you for any reason just because you have an illness or an injury. There is no shame in having IC. There is no shame at all. Today's Mother's Day, right? And I would not be here today if my mother hadn't been there for me. 100%. 100%. When I could not speak, she spoke for me. When I could not drive to the emergency room because I was writhing in pain, she drove me. My parents are my hero. My mother is my hero. You couldn't have a better person with you than my mother if you were sitting in the hospital or the emergency room. She just literally sits right next to you and holds your hand. It's just like complete unconditional source of love. It's absolutely amazing. But what I do want to say here is that having IC does not change your ability to be a mom. It doesn't. It doesn't change your ability to be a friend. It doesn't change your ability to be a daughter. It doesn't change your ability to be the person you were meant to be. Yes, it's hard. Yes, it's challenging. Yes, we have to learn about it. We've got to dive into a lot of self-help. We've got to have a zest for knowledge. We've got to knock on as many doors as we can until we get the correct diagnosis. But in the end, I think that a mother who has IC will be more compassionate. Here's the one thing I can guarantee you, you will never, ever, ever walk away from someone in pain, ever, because you know what it's like to suffer alone in pain. And that will make you a better mother. But our goal here is to get you to the point where you've got your life back again, where you can do things again. We want to get you out of your bedroom, out of a dark room and into the light. We need to get you feeling better. We need to start working on healing whatever it is that's going wrong with you. And that's the challenge with IC is back in the old days, everybody thought this was an incurable bladder disease. We don't anymore. Now we realize that this is a pelvic pain syndrome. Why? Because other structures in the pelvis are often involved, period. End of story. We know that now. We know that now. You go back 100 years, you look at the research that was published 100 years ago, what do they describe? Muscles so tight, they're like tight piano strings. But urologists like to play in their sandbox. They like to play in the urinary tract. So yeah, they describe tight muscles, but did they do anything about them? No, they didn't. Not until like 15 years ago. Now we know that tight muscles, now we know that pelvic floor injury can play a huge role in your symptoms. And in fact, for those of you whose symptoms began after a pelvic trauma, falling on your tailbone, a history of athletics, if you were a paratrooper, if you were a football player, if you were a gymnast, if you were an ice skater, you are potentially curable. And that comes from Dr. Christopher Payne, the gentleman who ran the IC research program at Stanford University for 25 years. That is what he said. So my job in this meeting is to open doors for you, to give you additional knowledge, to kick you in the butt and get you to start talking to people again, start talking to doctors again, things like that. And I want to try to give you a little bit of a reality check here. There is hope. There is hope. Patients are doing better substantially now. I'm doing better. I had a doctor tell me I would live in severe pain for the rest of my life. He was wrong. I'm pain-free most of the time. 95% of the time, I'm pain-free. So screw him. Screw the naysayers. We got to follow our journey here. So normally what I do in these meetings is I do a little 30-minute lecture, and then I take your questions, and then we go to Zoom. I don't really have a lecture prepared for today because it's Mother's Day, and I've been hanging out with my mom. So let's just go ahead and dive into your questions. So again, and on YouTube, so we're simulcasting on Facebook and YouTube. If I'm looking here, I'm looking at Facebook. If I'm looking there, I'm looking at Facebook. If I'm looking here, I'm looking at YouTube. Okay, so bear with me, the wandering eyes. It is what it is. And on YouTube says, what can a flare feel like? Well, remember, you can have lots of different types of flares. You can have a bladder wall flare. You can have a pelvic floor flare. You can have a hormone flare. You can have a stress flare. And so generally, you're going to feel a flare unless you've done something really catastrophic. Let's just say you drank an energy drink. Like you just lost it, you forgot, you were out, you needed energy, you had an energy drink, an hour later, your bladder is screaming, you're peeing every 15 or 20 minutes. So a lot of flares can happen when you irritate your bladder. But generally, you don't feel it as it's happening. You feel it that night. You will feel it at night. Why? Because there are fewer distractions than during the day. And the same is true kind of with pelvic floor. I was, we're finishing up this book called IC 101. It's not just a bladder disease. And I should print out the cover. I was going to do a cover reveal today, but I haven't had a chance yet to print anything out. I was thinking about, this is the first book that talks about subtypes, and I tell my story in the subtype. And the thing that proved to me that I was having pelvic floor flares, even though I always thought it was my bladder, is I got startled really badly by somebody, and I was out and about doing something. And I thought that I was going to leak. So what did I do? I tightened my pelvic floor muscles. So for about 2 hours, as I was doing whatever it was I was doing, I was walking around. I was deliberately, forcefully tightening my pelvic floor because I thought there'd be a puddle underneath me. There wasn't. This only happened to me once in my life. That was after a dog attacked me. That was a long time ago. Anyway, so here I am going around, tight pelvic floor muscles, finally get home, finally pee, and oh my God, did I give myself a wicked flare. Give myself a terrible flare. And it felt like my bladder. I had frequency urgency pressure pain, but I knew exactly what it was. It was from my muscles. So they often present like this. You go to bed at 10. Of course, you peed before you've gone to bed. You wake up an hour or two later. You feel really full. You go to the bathroom. You pee out a quarter a cup of urine. You go back to bed. You fall asleep. You wake up 30 minutes later. Your bladder feels really, really full. You go to the bathroom. You pee out a teaspoon. You go back to bed. You try to fall asleep. Maybe you even do fall asleep. But 15, 20 minutes later, you're up again. Your bladder feels really, 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 really full. And you go to the bathroom and nothing comes out. And you push and push and strain, you might get a drop. Because at that point, your bladder really is empty. It's this false sense of fullness that is a sign that your bladder wall is really, 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 really badly irritated. Now, I was working with a patient on Friday who stunned me because she had a really strange reaction to this false sense of fullness. Like, so she felt like she urgently, desperately need to pee. So what did she do? She went to the bathroom. She'd sit on the toilet and she would strain and strain as hard as she could. She would strain and strain and strain, and nothing ever came out. And so that's when she whipped out the catheter and she'd start catheterizing herself. But she was straining so badly that she gave herself a urethral caruncle. You know what a urethral caruncle is? That is when your urethra tissue starts sliding out of your body, and it's like a little puff of tissue right at the exit to your urethra. Here, hold on a sec. Okay, no, there you go. So this false sense of fullness is classic bladder wall irritation. Classic irritation. And you kind of have to be a little bit logical here and go, okay, when did I last pee? 30 minutes ago. Did I drink any water? No. Is there urine? Is there any fluid in my bladder? Probably not. There's probably not much urine in your bladder. There's no reason for you to sit on the toilet and strain and strain and strain. Instead, you got to do the bladder wall flare management protocol. And the bladder wall flare management protocol is number one, hydrate. We got to get some fluid in there. Number two, you can alkalinize your urine with a little bit of pre-leaf, a little bit of baking soda, taking a Tums, a quarter teaspoon baking soda and a glass of water. If that doesn't work, you can go for the Azo bladder pain relief tablets that will numb your bladder wall. But the last thing you want to do is sit on your toilet and strain. And this poor woman, unfortunately, she's been doing that for years. Years, like 4 years, she has been sitting on her toilet and straining even when her bladder was empty. And when I actually went through the anatomy with her and explained what a flare felt like to her, she was stunned. She was stunned. So please don't strain, okay? If you come on over to our website, icnetwork.org, and you sign up on our mailing list, you can download our 40-page free flare management guide. It's free to people who sign up, and it gives you hour-by-hour rescue plans of how to get yourself out of a bladder wall flare versus a pelvic floor flare. Okay. Hi, Curtis. Curtis says, "Happy Mother's Day." Yes. She says, I think I'm going to try the IC multivitamin. Haven't had much energy lately. The low acid multivitamin is called Bladder Smart. That's what I take every night. It's just phenomenal. It just doesn't irritate the bladder at all. That was the other thing that this lady was doing, is she was taking 2 really strong vitamins in the morning and the evening. And she was just bathing 500% daily, 500% over the daily recommended dosage of vitamin C twice a day. And her bladder was screaming at her. It's so sad, you know? Your doctor never explained estrogen, atrophy, and all that sort of stuff. So for Bladder Smart, if you're looking for the low acid vitamin, let's see, here it is. And I'm casual today, you guys. Now I am wearing shorts, just so you know. I am wearing shorts. I'm not giving you a show here. But this is me. I like happy. This is a happy shirt. I live in a happy house with happy clothes. Okay, here it is. The Bladder Smart Low Acid Multivitamin. It's awesome. Elise says, last urologist I talked to at the hospital told me he considered himself to be a plumber. He wasn't interested in my symptoms at all. Oh my God. That's pathetic. Curtis also says the Pure and the bladder rest helped me out a lot. Donna says, what happens, Jill, when the bladder fills, it is painful. When you do urinate, you urinate a lot, no matter whether it's 30, 40, 50. Well, hon, that just means that if you have pain as your bladder's filling with urine that is relieved by urination, then we know your bladder wall is irritated. And the quantity doesn't matter. as long as your bladder wall's irritated and you've got any fluid in there, or even if you don't have fluid in there, you're going to have symptoms of frequency, urgency, pressure, pain. The question that we use, guys, is when is your pain the worst? Before you urinate or after you're done urinating? If you have pain as your bladder is filling with urine that is relieved by urination, that points us to the bladder wall. If your worst pain is after you're done urinating, that points us to your pelvic floor. If you have pain in your urethra as you're urinating, that could be a couple of different things. That could be estrogen atrophy. That could be, especially if you have urine burn or your urine feels hot, usually that's estrogen atrophy. Could be an infection of the periurethral gland. Could be a chemical reaction to laundry detergent, menstrual pads, things like that. All right, let me come over to Facebook here. I don't know about you guys, but like I do so much better when I use a straw. If I don't use a straw, I swallow air. I do not like that. Pam says, my bladder's bothering me today and it hasn't for a long time. Maybe stress. Lisa, stress. Hi, Margie. Latoya says, I'm newly diagnosed and wondering what exactly is a flare-up. There you go. Gave you that. Is it common to have bloating or pressure or low back pain? IC patients are well known to get something that we call the IC belly. And when I've asked numerous doctors what they think the IC belly is, and generally what they say is that it's inflammation. I used to get it too. I don't get it now, but where you wake up and you got a flat stomach and 2 hours later you look 6 months, 8 months pregnant. It's crazy. And then it goes away. Comes and goes, comes and goes. The low back pain, we would be looking at 2 things with low back pain. We would be looking at tight pelvic floor muscles, your psoas muscles in particular. We would also be wondering if everything is okay with your kidneys, especially if you have really, really sharp low back pain. Rhonda says, thank you for suggesting Dandy Blend. It's so good. It's really going to help me kick my coffee addiction. You guys, seriously, I'm in love with this new herbal coffee. Where is it? Here it is, Dandy Blend. It's so good. It's really, I mean, don't you agree, hun? It's really dark and rich, and yet there's 0 acid in it. There's no acidity in it, 100% caffeine free, no bitterness. You can get this right in our store. You can get it from Amazon, Dandy Blend. It comes in just a pad. You just rip it open, pour it in a big glass of hot water, and you're ready to go. And it's super affordable too, very inexpensive. So that's what I do now. When I need that hot cup of something in the morning, I'm going to do the Dandy Blend. Lisa says, heating pad works well for me. Awesome. Oh, you guys. So I'm bringing on a new heating pad. So, you know, we have our normal big heating pads, which are big triangles, which I think you guys have seen before. But the lady who makes those for us also has these, which are also, you know, just the right size to go from hip bone to hip bone. So I've got, this is our giveaway today. We're going to do a giveaway today. I've got 2 of these heating pads to give away. And if you can wait an hour or so, I will tell you with a giveaway. I'm gonna give you a hard question. You know, you got to work for it. Not like the old days where it's like the first 2 people. I really want to make it just a wee bit more challenging here. Kelly, thank you so much. Christine, thank you so much for the 150 stars you sent me on Facebook. I appreciate that. Georgia says glucosamine and hyaluronic acid help better when are added to chondroitin. Okay, so if we look at the very, very first formula that was created that was supposed to help the bladder wall, it was called Alginat. It was created by Dr. Theoharis Theoharides, who is at Tufts University, big federally funded IC researcher. And so he was the one who combined chondroitin and glucosamine with quercetin like 25 years ago in his first product called Alginat. Then within a year, he reformulated that and added hyaluronate to it because hyaluronate also has a bladder coating effect. And so Cystoprotec was the very first supplement that was believed to have a clear coating effect. And we know that that was validated because Dr. Theoretes did a very large study of over 250 patients who took it for 6 months. The data was published in the Canadian Journal of Urology. So Cystoprotec was the top dog for many, many years. And then things happen, things change. We've learned a lot about IC. We've learned that nerves are often involved. A lot of neuroinflammation can be driving some of the pain that we're dealing with. And so some of the newer supplements also work to calm nerves down, like Bladder Builder. For those of you who are still waiting for Cystoprotec, there's been a 5-month delay. We are supposed to get it this month. I am taking advance orders, but we don't have it yet. I don't have a date for you yet because they haven't given me a date. Here, you guys, hold on one sec. Hold on. All right, there we go. Lorraine, okay. Hello, Rain. Nice to see you. Hi, Christine. Teresa says, can you have surgery for this disease? Okay, well, so Teresa, number one, this isn't a disease for many of us. This is an injury. So we don't, we have to look at your subtype. Listen, there's tremendous diversity in this IC patient population. For some people, IC begins in childhood. For others, IC begins after menopause. For some, IC begins after having a baby, while for others, IC begins after chemotherapy. And so here's what we do know is that a one treatment fits all approach doesn't work. Why? Because there's such diversity in this patient population. And so what we have to do first, before we can have any sort of reasonable discussion about what the right therapy is, we have to understand your anatomy first. Are you bladder wall, pelvic floor, central nervous system, etc.? So we're doing something called subtyping now, where we're trying to do a much clearer diagnosis so we know what the right therapy is for your specific presentation. So as an example, if your symptoms began after a hysterectomy, or if they began as you entered perimenopause or menopause, the odds are you probably have an estrogen atrophy of your bladder wall. We know what to do about that. What we're going to do is you potentially use some estrogen so that your skin can start producing some of that natural mucus, and then maybe do something that has a bladder coating effect, like the Cystoprotec or rescue installations or things like that. The only context for which we would ever consider surgery is if your bladder was profoundly damaged. Profoundly damaged, if it was shrunken, if it's the size of a walnut, rather than the normal size that it is. So there's no magical surgical cure here. But the odds are that your symptoms might not even be from your bladder. I have a completely normal bladder. If you'd remove my bladder, that would not have solved my problem, because my problem is pelvic floor driven and central nervous system, right? So my symptoms began after I fell and broke my tailbone. Tight pelvic floor muscles, going back to childhood. And so what would we remove? There's nothing to remove there. What we have to do instead is rehabilitate the muscles. And the thing is that when we rehabilitate the muscles, many patients are cured. So I can go over that later if people want to talk about that a little bit more. Right, what's going on? Donna says, what if you're feeling pain in your vaginal area only, not your center pelvic floor? Could it be vulvodynia? Feeling it in both places. Sounds more like estrogen atrophy or pelvic floor. Donna, if you've got that, do you have a pushing sensation? Do you feel like there's something being pulled out of your vagina or pushed up into your vagina? That would be pelvic floor. That happens to me fairly regularly, a couple of times a week. Kelly says, I've been noticing that Valium rectal gel has been helping a lot with flares. So Kelly, the fact that Valium is helping you tells us that you have a muscle-driven, tension-driven disorder. Christine says, my gynecologist told me that my women who have endometriosis might have IC. True. That is true. They are called the evil twins. And ultimately, in the end, the connection is probably related to nerves and muscles. That if you've got endometriosis causes extremely painful periods. And because you're in pain, your pelvic floor muscles will get tight to guard you from that pain. Those tight muscles start restricting blood flow to the bladder, and then the bladder gets involved. There's also some neurological crosstalk there. So that's completely common. Latoya says, I want my, honey, you're going to get your light back. You will. We have to try to understand what's driving your symptoms first. Listen, don't assume just because you have frequency urgency that your symptoms are coming from your bladder. They might not be. They could be easily coming from your pelvic floor. They could be coming from a fibroid tumor. They could be coming from a Tarlov cyst. They could be coming from a lot of different things. Rhonda says, are there natural supplements for nerve pain? There are. Palmitoethanolamide, PEA, is the most common supplement now used to calm nerves down. And let's see here. We had our first PEA IC study presented 2 years ago at the American Urology Association, and the data was nothing short of astonishing. That by month 3, 87% of patients using PEA had a significant reduction in their pain. By month 6, 25% of them were pain-free, and the rest were doing remarkably well. That was using a formula called UMP from Europe. We don't have that in the United States, and so Natural Approach Nutrition created a formula similar to that for us here. It's called Piora, and it's a combination of PEA and resveratrol. And this is the only supplement that I take. And very low side effect profile, extremely well tolerated, extremely affordable. But the data, I'm going to be repurposing one of our other websites over into a website that goes over all the PEA research so that you can see that. PEA has been used for decades in Europe for nerve-related conditions from fibromyalgia to sciatica to burning mouth syndrome. They've been studying it with epilepsy. They've been studying it with chronic pain. And the general consensus among those researchers is that it is ideal for nerve pain. And it comes from a fatty acid, extremely well tolerated. Georgia says, is it okay to push when you're finished urinating? If you're done urinating, why would you need to push? For the last strip of urine, or is it better not to? I suffer from hemorrhoids and they bleed. Well, so hemorrhoids come from pushing and straining, and so anything we can not to do that is important. Sylvianne says, can we take aloe vera and bladder builder both? I don't think I would do that because I would at least pick one and start with one first and make sure you tolerate it well before you add anything else to it. I don't see them being counterproductive. We've had supplements for years like Sister Renew that have combined chondroitin with aloe, so not worried about that combination. But Bladder Builder is a really robust, aggressive formula. There's a lot of stuff in it. And I would be a little bit concerned that you're kind of muddying the water. So I personally think you want to pick one first and give it a shot. Make sure you tolerate it well before you add anything else to it. That would be my guess. And guys, let me just say here, listen, I am not supposed to give you medical advice. I am not your doctor. The only people that can give you medical advice is your doctor. So if you hear anything in this meeting that you think is meaningful, please talk to your doctor about it. That's my job, is to get you back to your doctor. Or your pharmacist, Okay, let's see here. Teresa says, take aloe, my urologist said. That's true. Aloe's been around for years. Aloe is known for its calming and soothing effect. The aloe product that we are particularly liking right now is called, where is it? Here it is. Aloe Path. And the reason why I particularly like this formula is it's a combination of organic anthraquinone-free aloe with PEA for the pain-reducing effect. So our original aloe patients, most of them transitioned over to this and really like it. A little bit of an extra oomph when it comes to being calming and soothing, having that PEA in it. Maria says, has Bladder Builder helped anyone with bladder wall pain? So Maria, we just did our 1-year follow-up study last summer with Bladder Builder. We surveyed everybody who had taken it. What I can tell you is that 60% of the people who tried Bladder Builder love it, and they're still on it today. 40% moved on. The 40% who moved on, reason number one was cost. Reason number 2 was their doctor wanted them to do something else, and reason number 3 was they had a side effect. Any of the supplements can, especially the chondroitin-based supplements, have the potential of causing some gut distress. Same, okay? So side effects are real. That's why we always say start with a small amount, see how you do, take it with food. Oh, wait, you don't take these supplements on an empty stomach, except for maybe the Peora, right? So of the 60% who liked Bladder Builder, about 25% report that they're completely pain-free using Bladder Builder, which is exactly what we hope because that's mimicking the PEA study. And then the rest are reporting shorter flares, fewer flares, and less painful flares. So that also is very exciting. So Bladder Builder is a viable option, but it's a very robust, aggressive formula. If you are super, super sensitive and you're afraid to try stuff like I am, then we probably wouldn't say for you to try Bladder Builder. We would say maybe try Bladder Rest, which is a really simple, kind of pristine formula for people who are more sensitive. It does not have the PEA in it, but you can get the PEA separately. Bladder Builder does have probiotics in it. And so some people react to probiotics because they can generate a histamine reaction. Not everybody, but some IC patients do. So if you're somebody who flares when you take yogurt or you do acidophilus, something like that, then Bladder Builder would not be our suggestion to you. Kelly says, I always sit on the toilet a little longer and relax. Yeah. Or you do the up and down, up and down. Anybody ever do that where this is very common for women as we get older. It's like you think you're done and then you wait and go, nope, not done. And then you stand up and you go, not done, sit down. That's funny. Life is funny. Kelly said, ever since I had my hysterectomy, my IC went away, but now I have a lot of burning on the outside, 12 doctors and no one knows why I burned. Kelly, it's called estrogen atrophy. Estrogen atrophy. I have burning on the outside too. If I don't use my topical estrogen cream on my vulva at the entrance to my urethra, I would get lots and lots of burning. So that would be the very first thing we would suspect is estrogen atrophy. And the second thing we would want to know is there any chance that you're having any unusual muscle problems because of your hysterectomy? I went through 10 months of really agonizing levator ani spasms where it felt like there was a hand up my vagina grabbing onto my scar and trying to pull it out of my body. 10 months of that before pelvic floor physical therapy stopped it. And so sometimes muscles can cause a burning sensation too. But the fact that you have burning on the outside really points to estrogen atrophy, my friend. I would encourage you to Google genitourinary syndrome of menopause. Genitourinary syndrome of menopause. Teresa says, I've heard for over 2 or 3 months and the doctor doesn't do anything. Teresa, tell us how you're hurting. We need to know how you're hurting. Where are you hurting? Are you hurting inside of your body or outside of your body? Is it low? Is it shallow by your skin or is it deep inside your body? Is it to the left? Is it to the right? We need to tell us more about where it's hurting. Maria says, where's the info on how to get out of a bladder flare? Maria, just go over to icnetwork.org and sign up for our mailing list and it'll be in your thank you letter. You'll just download it. Heidi says, does it ever go away? Does what go away? Does pelvic floor tension go away? Yeah, if you work on it. Can the bladder heal? Absolutely. Healing is always happening in the bladder. Our challenge is sometimes we get in the way of healing. One of the ways that we get in the way of healing is by drinking coffee or energy drinks or things like that will make it very hard for the bladder to repair itself. Your bladder is not designed for a 24-hour acid wash. Period. End of story. There are some patients, though, who have Hunner's lesions. Hunner's lesions are harder. Hunner's lesions are kind of one of the mysteries of IC. We've got 2 theories. We think that they could be viral infections. We got research showing that viral infections do happen in the bladder, specifically the polyoma BK virus. We also know that quite a few people are struggling with fungal infections. That is a result of next generation DNA urine testing done by the National Institutes of Health. And so I have an article on our website. Could Candida cause IC flares? Absolutely. And our own National Institutes of Health proved it. They proved it, that many patients who are flaring because they have an overgrowth of Candida. So we're not all the same. Kelly says, is Bladder Smart okay for vulvodynia? Yeah, it should be fine. Maria says, has a PEA supplement helped anyone with the pain? Yes. Yes, it has. Maria, it has. We have a whole research study that proves it. Anne says, do flares go away? Yes, they do. Flares do go away, but we have to figure out what kind of flare you're having. Eve is at urgent care right now. Girl, hun, I am so sorry. They're ruling out a UTI. Okay, let's see what you got. You know, there is always a possibility of chronic infection. That there are some patients who do have chronic UTI, especially older women with estrogen atrophy are much more vulnerable to chronic UTIs. So it's good to rule out UTIs. It's even and if you have somebody where your doctor, you keep having UTIs and the antibiotics are working and then they stop working, that's when something like a next generation DNA urine test might be useful. That's what infectious disease doctors do because it will tell us what antibiotic resistant genes you might have. So there is a place for that more aggressive testing if they think that you have a funky, difficult, challenging infection. Hello, Bill on YouTube. Bill says pumpkin seed oil seems to provide relief. Yes, we had research about 15 years ago presented at AUA about pumpkin seed, specifically for prostatitis and chronic prostate issues. He said, is it a good idea to drink alkaline water to make sure the bladder? No, I'm not an alkaline water fan, guys. I mean, listen, um, uh, as a chemist, this is what I say, and you're going to think I'm nuts, but I'm going to say bleach will eat your eyeballs out just as badly as sulfuric acid. I don't know where, that was from some chem lab instructor years in, when I was in college. So acid is irritating. Acid is damaging. If you spilled sulfuric acid on your skin, you're going to have a burn. But have you ever spilled bleach on your hand? Bleach is not acidic. Bleach is alkaline. And when you spill bleach on your hand, what happens is it gets really slippery because the alkalinity is basically destroying the cells. So we don't want to be too alkaline or too acidic. We want to try to be pH neutral. So man, if you want to have one alkaline water a day, is that harmful? I don't think so. But doing alkaline water all day, every day is just as bad as drinking acid water all day. They're both irritating. Your goal is to try to be pH neutral. I mean, I remember I was at a food show in San Francisco and somebody had alkaline water and I took a little shot of it and it stripped all the mucus out of my mouth, all of it. And I'm like going, oh my God, the last thing I want to do is strip the protective mucus out of my bladder, right? So I'm not a fan of alkaline water. Plus it's expensive. Spring water. If you have good water like we do here in Northern California, tap water is fine. If you've got bad water, then look for a normal spring water. Distilled water is not recommended because it doesn't have essential minerals in it. You want to do a spring water if at all possible. Doctors, let's see. Patty said, happy Mom's Day, everyone. I'm past the 3-month mark on hysterectomy. Woohoo, girl, congratulations. You are over the significant healing, but you've got another 6 months to go. Follow your instructions. Don't lift heavy things like I did and tear sutures. But I have one stubborn incision that hasn't quite healed, but I think I restarted physical therapy, and I think that might do the trick since my muscles are still tense. It might be a wee bit too soon to start the physical therapy, hun. I had my physical therapy. I tried physical. Let's see. I had my hysterectomy in May. I tried to have physical therapy in August, and it did not work. I was able to do it in December. So it might be a wee bit too soon. It might be, I don't know. You could talk to the physical therapist about it. And maybe what they can do is do external work before doing internal work. I know for me, because I was having this terrible pulling sensation, I would have kicked somebody who tried to do internal work on me back then. It's like, don't, don't, don't freaking touch me right now. That's how I felt. Heidi says, is it curable? Well, it depends upon your subtype, hon. If you've got pelvic floor tension, that's curable. If you got pudendal neuralgia, that's curable, but that takes a lot of work to get there. If you've got chemocystitis from chemotherapy, that is curable. If you've got coffee-induced cystitis, that is curable because your things are healing. But if you've got a viral infection, viral infections are not curable. Viruses tend to stay with us. So and if you got IC subtype 5 central sensitization, then sometimes that's just how you're built. You're built to have more sensitive nerves. But when Dr. Christopher Payne released his 5-point subtyping system, the one thing he remarked on is how cruel it is to tell patients that there is no cure, when in fact there is cure. Cure is possible, but we have to know what your variant of IC is first. If you've got estrogen atrophy, we're not going to cure drying. We're not going to cure aging. You're going to get older. Your skin is going to get drier. We need to do stuff about it. I hope that makes sense. Did that make sense? I had Swedish pancakes this morning. Now, I don't know about you all, but like I have gained a little bit of weight. Cinnamon rolls have never tasted better than they did during COVID. And so I have been doing everything I can not to start the day with carbs. But today I started the day with carbs because that's what my mother wanted, Swedish thin pancakes. So I might be a little bit sugar hyper right now. Jamie says, my urologist of 11 years retired in San Antonio. So if anyone in the area has a suggestion for a good doctor, the last one I saw was an older man from prehistoric ages and said, I did this to oh, well, if he said you did it to yourself, then he can just shove it. You guys, I do have a database that was given to me by my friend at Harvard, Dr. Elise Day. And so we can look it up in that database if you want. Is it open? Hold on. Let me see if it's open. Oh, it is open. So I can look up areas. I can look up states. Let me look up Texas here real quick. So this is a list of urologists, pain management specialists, physiatrists, physical therapists, radiologists, neurosurgeons, pelvic pain centers, etc. The only contact for San Antonio is Urology San Antonio, urologysanantonio.com. Rhonda says, is the heating pad weighted? Yes, it is. This is a good, it's not as heavy as our other one, but this will do in a pinch, my friend. This will do in a pinch, that's for sure. I don't have the instructions on how this should be heated. I know our big one, I use it every night on my neck too. I heat it for 2.5 minutes. I bet this one's going to be 1 minute or 1.5 minutes because it is smaller. Pamela says her vulva is red as Rudolph's nose. You know, Pamela, sometimes that redness is a result of neuroinflammation, but sometimes we are naturally red. Like I'm actually stunningly red down there, normally anyway. But the times that I've gotten much redder, it usually relates to tight pelvic floor muscles. I mean, the last time it happened was like 2 years ago when I was dealing with pinpricks and they thought I had eczema on my vulva, and it turned out instead to be pudendal neuralgia. And so once we got the muscles released and the nerves calmed down, quite a bit of the redness went away. the dark hamburger-like redness that you look at and go, ah. Teresa says they took urine by catheter and no flare in that, so we don't know what he said. Okay. Lori says, any thoughts on platelet-rich plasma injections to help with IC? We certainly have some research that shows that it could be helpful. Not a lot of doctors are doing it right now. I think you just need to talk to your doctor about what the pros and cons are. Annie says, I was wondering, have other patients had an increase in bladder pain due to the COVID-19 vaccine? So I'm going to say now, I had my second shot a week ago last Thursday, which is why I didn't do the meeting last week, because I was in that 24 to 48 hour Logie period after you have your second vaccination. I had no flares at all. My side effect from the second shot was just extreme fatigue and a headache. I had a headache too. But like 3 days later, it was gone. I'm going to say, now this is just my guesstimate, because we're not doing a vaccine study. We're doing a COVID study when IC patients get COVID. I think that about 90% of IC patients who get the COVID vaccine have no issues with it, with their bladder, but I think about 10% do go through bladder flares. Jamie just said right here, I did not have any increased symptoms after the vaccine. Carolyn says, hope you're well. Hello, Carolyn from England. Carolyn, you know what I got my mom for Mother's Day is I got her a book on Queen Elizabeth being a detective. That who knew that behind the scenes she could solve murder mysteries. For my mother. Angie said, a lady in another support group sent me some samples of Eurojet for installations. First, just inside the urethra, less than an inch. And you fill the syringe up. No need for a full catheter. I love them. Angie, they're still very new in the United States. We've known about Eurojet for a couple of years. I just don't know many people who are using them here as yet. So a Eurojet, imagine something that you can just put at the entrance to your urethra, squeeze it, and it gives you your bladder installation with no catheterization. That's the Eurojet. And I think, who was it invented? It was invented by one of the top IC doctors in Europe. Nancy says, can our city water supply, which is chlorinated, have the same drying effect as alkaline water? I'm trying to drink my 6-8 ounces a day, and I'm experiencing dry mouth symptoms. I guess you won't know unless you mix it up. I mean, maybe what you could do is invest in a good spring water for a month and see if that makes a difference. But remember that dryness happens as we get older and when we're women due to estrogen atrophy and changes in our hormones. And so how old are you, Nancy? That's what we would want to know. And is your dryness related to that? Or guys, a lot of the IC meds are known for causing dry mouth. If your doctor has you on amitriptyline, hydroxyzine, some pain meds, bam, those will also cause dry mouth. Marcia says, I have severe pulsating bladder spasms that begin after urinating. They start in your vagina, radiate up into your whole abdominal area, and spasms continue until your next visit to the bathroom. That's a very good description of a bladder spasm. So have they given you some ditropan or Detrol? Ditropan, also known as oxybutynin, can usually stop bladder spasms in 20 minutes. I've only had bladder spasms once in 28 years, and it was the result of what I thought was a flare for 6 weeks turned out to be an acute infection. And the infection got worse and worse and worse. And then finally, I started having bladder spasms. And bladder spasm, at least for me, what happened is they started as the last couple of drops were coming out of my urethra. And you're just bent. I mean, it's just like oh my God, you're just bent over. The spasms are so severe. And as they radiate up your spine, they radiate down your back, and you literally don't move. You don't move for 3 to 4 minutes while that spasm is happening. Ironically, I didn't know what that was when it first happened to me, and I went to because I ran the IC support group. I was the only Kaiser Permanente sponsored support group in the country, and I frequently went down there to bring them things. So I went down there one day, and I just burst into tears. And the nurse, they'd never seen me cry before, and she pulled me back inside, even though I didn't have an appointment. And I explained it, and she goes, "Jill, don't you know you're having a bladder spasm? Let me check your urine." And yeah, who knew? My flare turned out to be a UTI. And again, that's only happened twice in 28 years. So Marcia, ask your doctor. You guys, one of the hard parts is trying to differentiate between a bladder spasm and a pelvic floor spasm. A bladder spasm, there it happened again, is a smooth muscle spasm. It's a spasm of the smooth muscle of the bladder itself. A pelvic floor spasm is a spasm of the skeletal muscle in your pelvis. So smooth muscle is organ muscle. Skeletal muscle is muscle that helps you move. They have different treatments. If you're having a smooth muscle spasm, you need a smooth muscle relaxant, and that's going to be ditropan, also known as oxybutynin, or Detrol, which is tolterodine. If you're having a skeletal muscle spasm, and the skeletal muscle spasm, it can happen as you're moving, as you're walking. There can be a downward sensation, an upward sensation, a pulling downward, a pushing upward. Or when you go to urinate, you can't start your urine stream right away because your muscles are so tight. You hesitate 5, 10, 15, 20 seconds. That's how I know that my muscles are starting to get tight. If my muscles are normal, I can pee like a horse. If my muscles are starting to get tight, my stream gets thinner and smaller and stop and start and hard to start, and just hard to start urinating in the first place. That's how I know I'm having a skeletal muscle issue. And so what I do is I use a skeletal muscle relaxant, Flexeril, Baclofen, Valium. So the ditropan isn't going to do a damn thing for a pelvic floor, just like the Valium isn't going to do a damn thing for your smooth muscle. Okay. Heidi says, I have 2 indentations in my bladder. What are those? Sue says, I give up. I'm tired of taking a million pills, drinking nothing but water, physical therapy, no medical support. You're so frustrated. Sue, girl, I hear you. I hear you. I know where that frustration comes from. I have been there too. But listen, you have never been more prepared to deal with whatever happens to you than you are at this moment, because you are truly one day older and one day wiser. You've gotten this far because you're a strong, kick-ass woman, and this is not going to defeat you. What we have to accept, though, is that what you're doing at this point in time has not helped you. And we have to figure out why. Have you missed something? That's what the American Urology Association says. If you're not responding to therapy, if you're getting worse rather than better, everybody needs to take a stop, time out. Let's revisit the diagnosis. Let's make sure we missed something. So, Sue, let me tell you the story of a patient, another patient on Facebook whose name also happens to be Sue. She too was diagnosed with IC. She did every bladder therapy out there. Things never got better for her. She didn't respond to therapy. And then she got on to pelvic floor. And something very interesting happened when she started pelvic floor therapy. The pelvic floor therapy always hurt. It always hurt. It's like, that's odd, because normally after a couple of times of pelvic floor physical therapy, the muscles start to relax. But in Sue's case, they always hurt, and they always hurt in one specific location. So she attended one of these meetings where I say, hey, listen, you're an anatomical mystery to be solved. We got to figure this out. She went back to the doctor and she requested some imaging. And so they either did an MRI. I'm not sure what they did, MRI, CAT scan. I'm not sure. But you know what they found? What they found was a big mass of scar tissue woven through her pelvic floor on her left side, which is exactly where it hurt, on her left side. And she knew exactly what that was from. She'd fallen off a horse very badly right there. So in her case, her bladder was a secondary victim of a traumatic injury. And the correct therapy for her is to try to work on that mass and work on relaxing those muscles. And she was going to have surgery for that because it was a really big, massive tissue. So, Sue, I would love to talk to you this week. I'm pretty good at kind of going through options and helping you maybe do a little preliminary subtyping, try to figure out if you could have been missing something. Do you have a tailbone injury? Tailbone injuries are common. Now that we know to ask that question, it's stunning the number of patients who have tailbone injuries. Stunning. So is your tailbone in the right position? Is it crooked? Did it heal incorrectly? Is it going to the left or is it going to the right? That would explain it. If you do pelvic floor physical therapy, are your muscles always tight? No matter what you do, your muscles are freaking tight? That's when we have to take a look at what puts stress on the muscles, which are bones. Do you have a bad hip? Do you have a bad SI joint? Do you have a bad knee? Do you have a bad foot? It's Dr. Jerome Weiss in his book, Breaking Through Chronic Pelvic Pain, describes this as we have to reveal the layers here. And often the last layer to be revealed are any bony structure abnormalities. We had a big research study released last summer, which showed that 70% of the men with testicular pain had an underlying orthopedic hip abnormality. It was a hip problem that then caused a muscle dysfunction, which then triggered bladder issues. So the last piece of their therapy was referring over to an orthopedist to figure out what they could do to work on those hips. And that's something that we see in the IC world now. Why do I have chronic muscle tension? Because I have a bad left SI joint. And we have to work on that. COVID has stopped us from working on that. Donna, let's see, hold on. How do we know that we have pelvic floor dysfunction rather than bladder issues? Well, they feel very, very similar, but there are some subtle differences. Bladder wall pain is very sharp and shrill. It feels like a razor blade. It feels like ground glass. Okay, it's intense. When you've got bladder wall pain, your day is controlled by volume. Let me see it. Look, I've got a picture here. Hold on. Okay. So let's say that you're IC subtype 2 chemocystitis. So let's say you're a cancer patient going through chemotherapy. You've got all these symptoms, frequency, urgency, pressure, pain. Somebody told you you have IC. So this is an example of what a bladder could look like when it's been chemically injured. You see how we call these petechial hemorrhaging, glomerations. You can see that they're bloody, they're small, discrete, but they're obviously little wounds. Now imagine that when your bladder starts filling with urine, fuller, urine is now getting into these wounds. And that is what is driving your pain and discomfort. So if you feel pain as your bladder is getting fuller and fuller, and then once you pee, the pain goes away, that helps us point to your bladder wall. Pelvic floor pain is different. Pelvic floor pain is duller. It's achier. It has a burning quality to it. But your day is not as controlled by volume. When you've got bladder wall irritation, you're going to feel anything in your bladder. With pelvic floor, you can walk around. You're not tied to the toilet quite as much. I mean, you're still there, but not as much. But the key difference is, when is your pain the worst? Before you pee or after you're done peeing? If you have pain as your bladder's filling, that points us to your bladder wall. If you have pain after you're done peeing, that points us to your pelvic floor. And of course, the classic symptom of somebody with pelvic floor dysfunction is, can you start your urine stream? Can you sit on the toilet and pee like a horse? If you can't, if you hesitate 5, 10, 15, 20, 30 seconds before you can release urine and then you're dribbling, that's probably because you've got pretty tight pelvic floor muscles. And for those of you who are interested, these are pictures of Hunner's lesions. This is considered the more severe form of IC. It is characterized by having a center lesion. So here's our center lesion with kind of radiating arms. This is IC subtype 1 Hunner's lesions. And we have two theories on why these happen. Number one, that it could be severe neuroinflammation, or it could be a chronic viral infection. We have several research studies from Europe that have identified polyoma BK virus, Epstein-Barr. We have some suggestions about herpes and HPV as well. And now, of course, we do also believe that COVID can infect the bladder wall in some people as well. And here is a little piece of trivia for you. Look at this. Isn't that freaky? That, my friends, is a bladder stone. That is a stone growing. There's two of them. There's one here, and actually there's a couple down here. Bladder stones are not part of IC. We had a gentleman diagnosed with IC, and he had these emerging from his bladder wall. This is not IC. This happens when you sustain severe bladder injury. What happens? So he had many surgeries. He was a surgical malpractice patient, not an IC patient. He had 13 surgeries to try to repair damage done by the first doctor, who is now in jail. But what happened is, in one of the surgeries, they left a bleeder in his bladder, and they sent him home, and his bladder filled up with blood clots, and it became an emergency. And when they got him back into the hospital and to the OR, his bladder split in two from pressure. When they sewed the two pieces of his bladder back together, this happened. Because when the bladder wall is severely damaged like that, a calcium metabolism gets messed up, and it starts producing stones in the tissue, and they grow out of the bladder wall just like the Himalayas. I mean, it's just shocking. And this is a freaking big stone. So he was throwing, they had to go in. They stop eventually, but again, not an IC patient. You don't need to worry about that. But it's just an interesting piece of bladder trivia. Deb says, can skeletal muscle tightness cause constipation? Absolutely. Absolutely. Constipation is very common in people with tight pelvic floor muscles because you can't relax enough to empty your bowels. We have on our website a database of doctors, and I also have a database here of doctors and physical therapists. So if you want me to look somebody up for you, I can do that. All right. And getting back to you, Sue, listen, if you want to call me this week on Tuesday, Wednesday, Thursday, I'm having an epidural, so I'm going to be out Thursday or Friday. But Tuesday or Wednesday, please feel free to give me a phone call at the IC Network office. I'd love to talk with you. I bet we can find something. Donna, hi, Jill. I think I have IC. I've had symptoms for 2 months, was positive for ureaplasma, and you've been on doxycycline for 2 weeks. Felt better, but now the symptoms are still there, but medicine is hurting your stomach. Can ureaplasma bacteria cause IC, or maybe the antibiotic isn't working? So the correct question, Donna, is can ureaplasma bacteria cause the symptoms that we associate with UTI? And the answer is obviously frequency, urgency, pressure, pain. Those also happen to be the symptoms of IC. But if you have any positive bacteria that's pathogenic, you are excluded from a diagnosis of IC. You would instead be diagnosed with a ureaplasma urinary tract infection. And ureaplasma infections they're hard to isolate and they're hard to treat. So it's going to take some work, and maybe working with an infectious disease doctor, again, maybe doing some more advanced urine testing, like next generation testing, to see if they can identify any drug resistance genes that you might have. Not everybody's a fan of next generation DNA testing. Like I always say, I think it's data, it's meaningful data. But it's very important to understand that the National Institutes of Health completely supports the use of next generation testing. A lot of the new cutting edge IC studies have been using next generation DNA testing. All the fungal findings in the IC patient population was due to next generation DNA urine testing. There are several companies that are using it, and I think it's useful, potentially useful information. The challenge is, what do you do with the results? The data is hard to interpret. Like, if you're asymptomatic, if you have absolutely no symptoms at all, but you come back with a small amount of E. coli or something like that, most people would say that's not worth treating. You're not symptomatic. It's about, do you have unrelenting symptoms that suggest UTI? The nice thing about the next generation DNA testing is it will at least give you a clue, and then you and your doctor maybe can consult with an infectious disease doctor or whatever to see if there's anything meaningful there. But the data is hard to interpret. I would be the first to say that. Last year at the American Urology Association, Dr. Curtis Nickel gave a lecture where he believes that next generation testing will completely replace urine culturing sooner rather than later. And I agree with that. I mean, I think it's good data, but interpreting the data is remarkably difficult. It's remarkably difficult because we really don't know what a normal urinary biome is. I mean, if you come back 90% E. coli, there's a problem. If you come back 3% E. coli, that might not be a problem. It might be completely normal for you. Oh, we can go on on that. There are so many debates. Hello, David. And yes, there are several different companies that do next generation testing. Microgen is one. Aperiomics is one. The other one is on the tip of my tongue. DJ says, I had a urine culture come back with staph coagulase, over 100,000, but my urogynec said that it shouldn't be treated, but I feel like I have a UTI. Let me look something up. Hold on a sec. The coagulase positive staphylococci constitute the most pathogenic species of S. aureus. And that's old, man. That's 25 years ago. Can cause superficial skin lesions, boil styes, localized abscess. It can cause deep-seated infections like osteomyelitis and endocarditis, more serious skin infections. It's a major cause of hospital-acquired infections of surgical wounds. It can cause food poisoning. It can cause toxic shock syndrome. S. saprophyticus can cause UTI, especially in girls. Now that's from a book, Medical Microbiology. It's a little old. I think that's honestly worth talking with. Maybe you can ask for a referral to an infectious disease specialist. See if they can give you a little bit more insight on that, hon. Because if you're over 100,000, you got something going on there. I just don't know. DJ says Dr. Elise Day was her urologist before she moved to Boston. Dr. Elise Day, who is a friend of mine, is one of the editors of this fabulous new book called Facing Pelvic Pain. And the reason why this book is so good, this is the book we needed 25 years ago, because it covers every condition that can cause symptoms associated with IC. It goes over conditions of the reproductive tract, muscle conditions, bony structure conditions, diseases, all sorts of things. This book is absolutely phenomenal. So If you are getting worse rather than better, or if you have a completely normal bladder and you're still struggling with IC symptoms, this book can help you figure out if there's something else that's victimizing your bladder. And the cool thing about this book is it's free on Kindle Unlimited. It's absolutely free. So, Facing Pelvic Pain by Dr. Elise Day. And she is a urologist at Harvard Medical School. Whoops. Whoops. What do I say? It's not a support group meeting until something falls. Julia, does anybody else have problems with diverticulitis along with IC? Because I do, and it's such a nightmare. I don't know how to heal them both. And you have severe IBS. Honey, I'm so sorry. I'm so sorry. Sue is asking for Kansas City, Missouri. Julia, I am assuming that you are working with a really good gastroenterologist for your diverticulitis. And again, if you're not responding to therapy, maybe it's time to ask for a referral to a regional doctor. You know, there are three different types or three domains of doctors. You've got local doctors, regional doctors, national doctors. The local doctors obviously treat the majority of people out there, but if your condition exceeds the skill set of your local doctor, they will send you to a regional doctor. Regional doctors are usually in different parts of states. So like the regional pelvic pain doctor for me is in San Francisco, which is 80 miles away. But they're the ones who take the more severe cases. They have more experience in it. But more importantly, they do more research. They're going to be much more up to date on new therapies and new things that are currently under study. But even some cases exceed the ability of regional doctors, and that's when you go to a national doctor. And in the ICU world, there are about 5 national doctors in the United States, maybe a few more. Robert Evans at Wake Forest, Ken Peters at Beaumont Health, Robert Moldwin at Long Island, Phil Hanno at Stanford, Chris Payne at Vista Urology. There's a couple in Oklahoma in that area too. So the same is true for irritable bowel syndrome, hon. If you've got severe IBS and your local doctor just really doesn't know what to do with you, it's time to ask for a second opinion. Get yourself up to a regional doctor. They may have more insight into you. Okay, Sue Ann wanted me to look up somebody in Kansas City, Missouri. The great state of Missouri. Let's see, what do we have? Washington University in St. Louis. Urology Surgical Center in, they're lead investigators in the MAP Research Network too, which is huge because that's a big federal thing. So Dr. Henry Lai at Washington University in St. Louis. You'll have to travel, hun, to get one of the top doctors. We also have a separate database on our website over on the IC Network website. So check that too, because there might be more in Kansas City. Do we have physical therapists in Kansas City? Columbia, yes. Foundational Concepts in Kansas City. There are 5 physical therapists that specialize in pelvic floor conditions. The name of the physical therapy firm is called Foundational Concepts. Jamie says, is there any way I can send you the information? I can't hear you. Go to our website, icnetwork.org. Go to our website. And I see on Facebook, y'all are talking about constipation. Please remember that to have normal bowel movements, you need to eat 20 to 25 grams of fiber per day, along with a good amount of water. So go back, look at your fiber, see what you're eating. If you're eating a salad because you think that's a lot of fiber, you're wrong. 1 serving of lettuce is 1 gram of fiber. 1 serving of green peas is 13 grams of fiber. So get your beans up, get your peas up, Google fiber-rich foods. I have started doing a little bit of rice and beans in the morning for breakfast, scrambled egg, a little bit of refried beans, a little bit of rice. It's working. Latoya says, should pre-leaf be taken with every meal, regardless of whether you're eating? Absolutely not. No, pre-leaf should only be taken if you're going to be eating something that's risky. You know, you cannot eat pre-leaf like candy. It is a calcium supplement. The calcium is going to go somewhere. And some patients have struggled with hypercalcemia, which can be manifested in the form of kidney stones. And so we don't want to be using it unless you actually need it. We've known that for years. You never do pre-leaf like candy. You don't want an over amount of calcium. And this is particularly true for people without a history of kidney stones, is that if you do have a history of kidney stones, you're going to be doing a different protocol. But for some people, if you have no known issue, but you just start taking lots and lots and lots and lots of calcium, there can be consequences to that, hypercalcemia. Sue says, can I give you access to the physician database? We have one right on our website, hon, that you have access to. Rhonda says, I had horrific bladder pain after the Moderna shot for 3 days. I wound up having an infection. Interesting. So it wasn't the shot that gave you the pain, it was the infection that gave you the pain. DJ said, my bladder spasm started the minute I woke up from my hysterectomy. I was 33, 7 years ago, and they haven't stopped. So DJ, kind of something similar happened to me, except for me, it felt like there was a large hand up in my vagina, grabbing onto where my cervix used to be, and literally trying to pull that tissue out of my body. It is the most awful, awful feeling. There are a number of complications that can happen with hysterectomy, and one of them is called vaginal apex pain, where a surgical in fact, you know what? I think it's even in this book. Hold on. Have you had physical therapy yet? Hold on a sec. Vaginal apex pain is real, a real post-surgical complication after hysterectomy. I mean, I think, hon, in your case, you are the perfect example of somebody, because you're struggling so severely, you need to up your game and go see a pelvic pain specialist. Where did I see this? It might be in the other book. Google vaginal apex pain. Raina, thank you so much for the 150 stars. Sue, if you need to talk to me, that's great. Our phone number is right on our Facebook website. Oh, and you have a hip replacement. Fascinating. Can bladder rest help with pelvic therapy? No. The only thing that's going to help with your muscles is muscle work. Maybe a PEA supplement might help calm some of the nerve pain down, but a chondroitin-based supplement is not appropriate. I mean, it's just not going to be functionally useful if you've got tight muscles. If you've got tight muscles, you got to work on the muscles. Maria says, should I be worried about natural vaginal birth with IC? No. Would a C-section be better? Absolutely not. No. Anything that we can do to avoid traumatizing the tissue is ideal. And so, um, uh, the best case scenario is for you to have a natural, healthy childbirth where nothing is torn, right? Whereas if you're having a C-section, you're opening yourself up to surgical wounds. You're opening up, so that you're going to have a good long discussion with your gynecologist about your obstetrician about your options there. Hawk says 52 days with no pain and voiding normal after having Hunter's ulcers removed. Yeah, baby. There we go. Now look at that. Look at that, guys. This is so important. One of the great tragedies in the ICU world are patients who are told they have Hunter's lesions, but nobody does anything about them. And these patients suffer for years with pain because their lesions were never treated correctly. Hawk here on Facebook, guess what? No pain, voiding normal after having the ulcers removed. That is what we see. When lesions are treated correctly with lesion-specific therapy, pain resolves dramatically. It pisses me off when that happens. And it's like, God, that's why whenever you're going to have a hydrodistension, you're going to have somebody look in your bladder. You always talk with your doctor about what are you going to do if you find lesions? How do you intend to treat what you find? And if the doctor says, I'm going to do nothing, I'm going to say, I would be saying, but wait a second. I want you to treat what you find. If you find Hunter's lesions, I don't want to come back in a month and have this done again. The AUA says if lesions are found, they should be treated. And they're treated with a steroid injection, laser therapy, fulguration, hyperbaric oxygen therapy, or they can surgically remove them if they're really severe. But once you treat the lesions correctly, the pain resolves dramatically in many of you. So Hawk, I'm so happy for you. Marion says, is it possible that ladies suffering from IC could just need hormone replacement therapy? Absolutely. Marion, yes. We call that the genitourinary syndrome of menopause. Very, very common. Very, very common. And again, it's so frustrating that here you are, you're postmenopausal, your bladder's starting to act up. They tell you you've got IC, they put you on IC therapies, and nobody ever explains the anatomy. The reason why your bladder is more sensitive is because you don't have a lot of estrogen. Remember, the bladder is the only organ in the human body designed to hold toxic waste, right? Because urine is body waste. Urine contains ammonia and urea and all sorts of bad stuff. So how can the bladder protect itself? And the answer is that your bladder is like your mouth. There's a hollow organ covered with a really thick coating of the mucus. We call it the mighty mucus. And the purpose of the mucus is a barrier. It protects the skin cells from whatever's in your urine. Unfortunately, it's estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus, you can get away with stuff. When you're older, guess what? You have much less estrogen, much less mucus. Thus, you cannot get away with much. And so what we see happening is for that woman who in her 30s and 40s had her sweet tea and a coffee, all of a sudden in her 50s, she's flaring from it. And she thinks it's a disease. It's not a disease. It's estrogen atrophy. Aging. It happens. It happened to me. The urethra is kind of like the canary in the coal mine. The first part of the urinary tract to really start screaming with a loss of estrogen is actually the urethra. It will feel like there's a drop of urine stuck in your urethra that won't come out. And it's extremely irritating. So again, in this situation, is this curable? No, because it's called aging. Your skin changes as you get older, but it's certainly very, very treatable. If we give that skin some if we give that skin some estrogen topically, it can start producing mucus. And that's exactly what we want. That's a best case scenario. We want to give the skin what it needs so that the skin can produce its natural protection. Now, if you can't use estrogen because of a cancer issue, that's when it gets really, really frustrating and really tricky. But therapeutically, this is where supplements like Sister Protect and Bladder Builder Shine, because the chondroitin-based supplements can give you a little bit of an extra coating in your bladder that will try to protect your bladder a little bit more. So, all right, listen, it's 2:15. It's time to start the Zoom portion of the meeting. So with the Zoom portion of the meeting, you get to come in and ask me questions. Facebook is going to stay on. YouTube is going to stay on. We'll be streaming on 3 platforms. And if y'all want to do it, that's great. If nobody wants to do it, that's fine too. I'll let you in one at a time. So hold on a sec. Let me just start it up. So in the Zoom portion of the meeting, I'm going to let you in one at a time. So the way you get there is you go to our website, icnetwork.org. And then once you're on our website, you're going to click on support right underneath the logo and go to the second option, which is streamed support group meetings. And then you click the link to Zoom. And I am starting it up right now. Well, I'm trying to start it. Oh, here it is. There it goes. All right. So the Zoom portion of the meeting is on, and oh my gosh, I look like it's a hot summer weekend. It is what it is. All right. So let me put this link in YouTube. All right, there you go, YouTube. Now Facebook, let me give you your link. Hold on one sec. Let's see here. I see network. It's so much easier if I'm on one computer, but one computer does not accommodate 2 internets. All right, so hold on a sec. All right, Facebook, there is your invite. And then guys, when I'm done, we'll do our giveaway. When we're done with Zoom, we'll go ahead and do our giveaway. I'm going to let Cindy in and Lawrence. Hello, Cindy. All right, guys. So let's just take a 2-minute break here. I need to pee. I'll be right back. You know, okay. So everybody, go use the restroom. Go get a drink. I'll be right back. And please don't unmute yourself until I do it. Okay. All righty then. All right, let's let Carla in. All right, so for those of you on Zoom, please remember that people will hear you on YouTube and Facebook because I will be turning the volume up. I'm going to call on you guys one at a time, and I'm going to come to Lawrence first.
Good afternoon, Jill. Nice to finally meet you. I've heard nice things about you, and I see you on Facebook and online. So anyway, thank you for having these little talks. Basically, I'm here today because I was diagnosed with interstitial cystitis back in 2016.
Okay.
But I've had symptoms since 1989.
Okay.
And I was just kind of wondering from you if you could give me just like your opinion about what might be the best medication or supplement that would cover urinary burning. So I know about azo and I know about pre-leaf, but I'm not sure about other things. And that's really the symptom that kind of drives me crazy. That's the thing I wish I could really get rid of.
Okay, so take me, number one, and please don't, if you don't want to answer the question, you don't have to. How old were you when your symptoms began?
I was 17.
Okay, what was happening back then? Any idea? Is there any event that you associated with the onset of your symptoms?
The only thing I can think of is that the year prior to that, I was diagnosed with irritable bowel syndrome.
Okay.
Okay. You know, it was a time of hardship in my life, a lot of stress,
okay.
A lot of teenager anger kind of thing, and you know, late 80s stuff that was going on then.
Sure.
So, yeah.
Okay, so the IC and the irritable bowel connection really points us to actually your central nervous system. You know, we call this chronic overlapping pain conditions. And so let me ask you a couple of other questions then. Do you have sensitive skin?
I do. I have a very sensitive sense of smell.
There you go.
I know for certain.
Okay, so that's it. So that's it. So remind me after we're done, I will email you the latest information on this because I'm in this subtype too. Okay, so I had frequency urgency in 7th grade when I was like 13, 14. Then I got vulvodynia, which you would not have, but that's okay. But for you, that would potentially manifested as perineal pain, rectal pain, testicular pain. Then the IBS hit in my early 20s. But I remember the first IBS attack I ever had was on the 4th of July when I think I was like in 6th grade. Okay, so last fall, the International Pelvic Pain Society had a fabulous meeting. And it was all about why does this happen? And first of all, you've done nothing wrong. This is not your fault. No shame, no blame, nothing at all like that. You have joined, you and I, you are my brother. You are absolutely my brother in this. And if I could give you a big giant hug, I would, because I'd love to hang out with you. 100%. They started doing, and don't let this freak you out, I'm going to explain it. It's scary at first, but it's not. They started doing brain studies about 10 years ago on IC patients and also on chronic overlapping pain condition patients. And I didn't talk about it because number one, I didn't understand it so well, and I thought it was scary, and I just really wasn't prepared to go there. But they finally explained it. And what they found is that your nervous system and my nervous system has something called a maladaptation. It's not a disease. It's not mental illness. It means that our sympathetic nervous system is stuck. So we have the parasympathetic nervous system. This is what keeps everything calm. And we have the sympathetic nervous system, which is what turns on when you're under stress. So if you opened your front door and you had a saber-tooth tiger across the street, your brain would recognize it, threat, fight or flight, sympathetic nervous system takes over, amygdala turns on in the brain, and your body is prepared to fight for your life or run for your life, right?
Right.
Then normally after After the stressor is gone, it turns off and the parasympathetic nervous system takes over. And what does it do? It it reduces your blood pressure, it reduces your heart rate, and it relaxes your muscles. But for you and I, it's not kicking in as easily as it should be. So the question is why? Why? And this was the most important part of this class. And it's all about pediatric risk factors. Why did it happen to you and me and not somebody else? And what they found is that in 80% of the kids that this happened to, in the year prior, there was a physical trauma, like a big physical trauma, like falling and breaking your tailbone, which is what I did, or being hit by a car, or falling off of your bike, or if you were doing football or soccer, you can actually rupture your bladder if you're playing soccer and your bladder's full and somebody kicks the soccer ball and hits you right in the right spot. That can actually pop your bladder like a balloon. So there can be a physical trauma, and I think because children have such a difficult time explaining their symptoms and what they're feeling, and because parents are dismissive and doctors are dismissive, we have doctors who don't believe that children can feel bladder pain. That child does not get treated correctly, so they have a long-term pelvic injury that changes, that we've got tight muscles, compromising nerves, everything gets wound up. There you go. That's kind of the explanation. And then in the other 20%, what they found was a history of bullying. And that even makes more sense, because imagine, like, I had a huge bully in my neighborhood who raped and murdered my neighbor. We were terrified of him. I lived in terror for years. Or just walking out the front door was scary because this guy was around and he hurt a lot of people, myself included. So imagine, you've got to go to school with a bully. So as soon as you wake up in the morning, bam, you feel it. You're scared. Sympathetic nervous system's taking over. Your brain thinks your life is at stake. You're in fight or flight as you walk out the door. And then you go to school, and then you're at school for hours and you're looking left and right every minute, looking for the bully. And then you leave school and you walk home and you're looking for the bully, waiting for the rock to hit you in the face. And the only time you get a break from that is when you walk in your door. For about 3 to 4 hours, you're at peace. And then mom says, go to bed. We got to go to school in the morning. And it tricks it up. So what happens is it becomes habitual. So how is this treated? It's fantastic. We know exactly how to treat it. And that is by turning the parasympathetic nervous system on. And it's remarkably easy to do. So, have you ever flown over a thunderstorm in an airliner?
I have not.
Okay. So it's really beautiful. Like, there's a lightning bolt here and a lightning bolt here and here. It's just this, it's like fireworks. It's gorgeous to watch. And as your brain is processing information, that's how the brain manifests it. When you look at a brain scan, it's lighting up different areas. And let's think about what your brain is doing at any given moment. Your brain's job is to protect you. So how is it doing that? It's by paying attention to your senses. What do you smell? Do you smell a fire? What do you hear? Do you hear a siren? Do you hear the bully? What do you taste? Does it taste good? Does it taste bad? What do you smell, etc., right? What are you touching? Is it hot? Is it cold? This is the data that your brain is using right now to make sure you're okay. And then your brain is also using your history. Everything that ever happened to you, your brain records. You might not remember it, but your brain does. So it's always going, God, have you smelled this before? What the hell is this? Oh, yeah. I smelled this in college when my neighbor was smoking hash. Okay, I know what this is, right? So it's always looking for context here. So the way we change how that brain is functioning is by engaging those senses again. The way we get it out of fight or flight is we force it to pay attention to our senses again. And that means, so we have something called, and I'm going to send you this. I want you to email me, and I'm going to send you this big 16-page article I wrote on this, all the data from this research. The research done on this is nothing short of astonishing. The problem is we all get offended. If somebody says mind body medicine, it's like, shut the F up. My bladder is screaming. I don't want you to tell me about my brain. Give me something for my bladder. And they don't explain it correctly. Okay, so that's what we're going to do. We're going to explain it. We're going to explain it correctly. So what we have to do are exercises which force your brain to pay attention to other things, like I Spy, where we're going to look at something and then we're going to smell something, et cetera, et cetera. And I can go through that later. Or there's something called tapping. And tapping is the same thing. We're going to use our hands to tap different parts of our body to force our brain to pay attention to what we're doing. We're giving the brain input. And so with tapping, you start, so you do 7 taps, 7 taps, 7 taps. And you can use a phrase or not use a phrase. And you can Google it. It's called emotional freedom tapping. The work with vets with PTSD, nothing short of astonishing, done by Harvard. So the first tapping is here, karate chop spot. So tap, 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 tap. Tap, 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 tap. Tap, 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 right? And then the next one is here. Tap, 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 tap. So you're forcing your brain to go, okay, what the hell's wrong with my eyebrow? And the third one's here. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. The next one's here. 1, 2, 3, 4, 5. 1, 2, 3. Okay. Here. And it's also accompanied with deep breathing. And you work through that, and it's amazing how much calmer you are. So how is your IBS now? Is it controlled, or are you still struggling?
I'm still struggling. I had a colonoscopy in February that showed some inflammation in the sigmoid, and it had like petechial hemorrhages on it. It looked a lot like what an icy bladder would look like.
Okay. And do you have anemia? Did they have, I mean, sometimes when you've got the little petechial bleeding, you can become a little bit anemic too.
It's not showing up, but I also do have interstitial lung disease. So
Okay.
I kind of battle these.
Where did you grow up? Where'd you grow up?
I live in New Mexico. I'm a native New Mexican, and so I live in the same place that I grew up in.
Are you up by
Santa Fe.
Okay. So you do have a lot of nuclear testing there. I mean, my brother was a nuke. He was stationed there for a while. So you almost have to also wonder about that to a certain degree. Right. Okay. In any case, let me just kind of summarize here. So we have to calm your sensitive nervous system down. That's the connection. Is that the nerves are amped up? We got to calm them down. And I'll send you the info so you can learn a lot more about that. Now, getting back to your question about the burning, is the burning at the tip of your penis or the base of your penis or deeper?
It's more towards the base. And
okay.
Sometimes I just don't even have it. And then other times I have it every day. And,
okay.
I do need to be more careful about my diet. I'm not as careful as I ought to be, but I don't really eat too many offensive things. I don't drink coffee. I don't drink sodas.
Well, you've got to protect your nervous system. You and I, we have to, we're going to be better in a quieter environment. The odds are you would never be happy in a big city. You need to be in the country kind of to a certain extent, right?
Yeah, I kind of live in a small town now.
Yeah, that's kind of the piece of that. Our nervous system, not everybody's wired for a high stress, big city environment. Some of us are meant to be artists and writers and to be in a quieter environment. I asked, here it is. So I'm going to send you this too. This is our latest magazine. And in here, I actually share the stories of 2 men who are now cured of their issues, but their issues are different than yours. But still, I think that you will really find this very, very helpful and encouraging. I have an interview in here with Dr. Elise Day, and I asked her specifically about men who have pain. Okay. So my question to her was, men often complain of pain in their penis, and particularly at the tip of their penis. Why does this happen? What tips can you offer to men who struggle with this? She says pain in the bladder, the prostate, and pelvic floor muscles are referred to the penis and the tip of the penis. In this situation, I recommend a multifactorial approach. We evaluate whether the bladder, neck, or the prostate is causing obstruction, and if so, address this. Bladder sensitivity can be addressed with anticholinergics. Pelvic floor physical therapy can help with the muscles. It can be helpful to employ one or more at the same time. And then she also goes into, how men are often misdiagnosed with prostatitis and all that sort of stuff. I'm sure that you've had many doctors tell you you have prostatitis. You've probably been on multiple antibiotics over the years for that, right? Have you had a pelvic floor assessment?
I haven't, and Jill, I'm extremely guarded about my pain, and the idea of anyone touching me where I hurt is a problem for me.
Okay.
So I haven't really embraced that yet, but I'm kind of slowly thinking that maybe, okay, I ought to try.
Well, so I will send you this too, and you will see the stories of two men who were cured with pelvic floor physical therapy. And again, it goes back to when you were 17 and like, what the hell could have happened to you? Yeah, you had the IBS, but was there a triggering event before the IBS too? And do you remember any injuries? Do you remember any big traumas?
Well, I had the bullying, and I did have a fall from a tree, and things like this happened to me. So
you fell out of a tree.
It kind of fits.
Okay, there you go. So that, in all likelihood, could have been the precipitating event for all of this. The bullying could have played a role or not played a role. We'll never figure it out for sure. But here's what we know is you sustained an injury, a significant injury, when you fell out of that tree.
I did.
And when you fell out of a tree, did you land on your butt or did you land on your leg? What'd you land on?
I landed flat on my back.
So okay. Okay.
Maybe about, it was a really big fall from the cottonwood. So it was,
Love those cottonwoods, but those are big, tall trees. Yeah. So, and did you even tell your parents you fell out of your tree, or did you just lay there?
No, I thought I was going to die, but nothing really seemed to happen when you're young. You can sort of bounce back, but I do remember that.
Okay.
We had a minor car accident, things like that.
Yeah. So, at a minimum, you need to have a pelvic floor assessment.
Yeah.
And you just read what I send you and go from there. And that will really give you some comfort and some encouragement. There's a fabulous, they're written by the team of physical therapists at pelvicpainrehab.com. Mm-hmm. And they are, I think, the best, if not close to the best, the pelvic floor physical therapy team in the world. And their articles on men are amazing.
There's some options at least.
Oh, there are so many options for you. So many options for you. So pelvicpainrehab.com. Everybody who's listening, sign up for the blog. Go there, read their blog. They're so good, but their articles for men are particularly good. Okay. So let's summarize this. You had a major trauma when you were a kid. You developed IBS, then you developed IC. And you've got interstitial lung disease, which is not related, but that's an interesting piece of this puzzle too. You've never had a pelvic floor assessment, so we don't know what's going on with your muscles. You do have burning. I'm assuming people have looked in your bladder.
We haven't.
Dude, are you forcing everybody to guess?
Well, since I live in such a rural area, people are the clinicians I go to are very perplexed by my symptoms, and they give me antibiotics. So
right.
I just got set up with a urological clinic in Santa Fe. There is a person there, Sandy King, who is a specialist in IC.
Okay.
I have an appointment with her in June.
Good.
So So I know that, that's going to be a good start for me in terms of some wellness.
So I don't want you to walk in and say you have IC. That's a mistake. I want you to walk in and describe your symptoms in depth. And you are an anatomical mystery to be solved. Our goal here is to get somebody to study your freaking pelvis to see if they can figure out what's going on.
Right.
Because here's what we do know: antibiotics never worked. And if I were to hazard to guess, I would bet your bladder wall's normal. I mean, are you diet sensitive? Are you particularly diet sensitive?
Yeah,
Okay.
I really respond very badly with sodas. Like if I drink a Dr. Pepper or anything like that, it really will flare me up. I have noticed that taking antihistamines really helps lower my inflammation.
Okay.
So I take a Claritin together with a Pepsid.
Okay.
And that just that really lowered my inflammation by about half.
Okay.
I feel like a pressure in the bladder. So there's something going on there.
Well, but it's the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, which comes first, the bladder or the pelvic floor? They're both involved, but one is primary and one is secondary. For some people, this can begin after chemotherapy, which damages the bladder wall, and because the bladder's screaming in pain, the muscles get tight. It's called the guarding reflex. But that's the smaller subset of people. For many more people, it begins after muscle trauma. So they've sustained a major muscle trauma. They don't know they have a muscle trauma. Their first symptom is frequency urgency. They go to the doctor, especially for a young man. The doctor goes, must be your prostate. They throw you on antibiotics. They can even be on antibiotics for years and you'll never get better.
For 10 years.
Right. Yeah. You go back to the doctor. The doctor goes, hey, you know what? You might have overactive bladder. They'll throw overactive bladder meds at you or Flomax or something like that. They don't work. And eventually they give you the IC lecture. I hate to say you got this incurable bladder disease. Here's Elmeron, et cetera. And ultimately, in the end, you could be on bladder therapies for years and never get better because that's not the problem. For this group of patients, the problem is poor blood supply from tight muscles. And so our therapeutic priority for this group of patients is to restore blood flow. And the way we do that is by working on the muscles and relaxing the muscles. So your nerves are involved, but it may have been the untreated injury that did it first, right? That may have triggered everything. So when you go, you need them to look at your body. You need them to look at your pelvis. So let them do a pelvic floor exam, which is obviously going to be a rectal exam, but it's very, very brief. And if your muscles are tight, you're going to get referred to physical therapy, and then you got to give that a shot. I'm looking at New Mexico right now on this database. There's Albuquerque, Urology Associates, Presbyterian Hospital in Albuquerque. Physical therapists. There's physical therapists in Los Ranchos de Albuquerque, in Roswell, New Mexico, Rio Rancho, New Mexico, and Santa Fe. So you got nothing to lose. Let's see if we can figure it out. You might be like the paratrooper that I worked with, where he was on antibiotics for years, and it was pelvic floor the entire time. Okay. All right. Well, listen, it was very, very nice to meet you.
Very nice meeting you, and I will send you an email so that you can follow up with the articles you mentioned.
Okay, I just sent you my email address as a direct message.
Okay.
See that?
Yep.
Okay, write it down. Send me an email so that I can email these things back to you. Okay.
I will work on that.
All right. Nice meeting you.
So nice meeting you.
If you ever have any questions, if you ever have any questions, you need a pep talk, you know who to call. Okay.
Thank you so much.
Okay, have a good one. All right, Cindy, thank you so much for your patience.
Not a problem, Jill. Good to see you.
How are you doing today?
I'm doing okay today. I just have a question.
Okay.
I went to my Uro-GYN last week because I had a massive UTI. So she has me on a daily antibiotic, and I still self-cath, but I've been trying to use my bladder. Like I don't want to self-cath constantly.
Right.
So she said that I have to self-cath more so that I don't get infections, and put me on another antibiotic. And I'm finding like my emotions are just all over the place having to do this self-cath stuff.
Well, why are you self-cathing again?
They've never said. And I have a recticel.
Okay.
She examined me. She said it is very mild. I said, so does that affect my bladder function? And she said, no. Look at my dog.
Oh, he's great. Corgi?
And my emotions are just all over the place.
Well,
I feel like I'm filling up landfills with these catheters. Like, it's insane. It's insane.
So are you completely unable to void naturally?
No, I can go naturally.
Then why are you catheterizing?
It doesn't empty.
Okay, so you're not emptying completely. How are you leaving a lot in there after
Yeah.
Okay. Okay. And so the doctor isn't quite sure why you're not
Why, and
emptying.
Right. And they've never even really looked in my bladder.
Well, but you have a prolapse. You have a mild rectal prolapse?
Yes. And she said that does not have anything to do with my bladder function.
Well,
and
but
that doesn't make sense to me.
Well, it speaks to your pelvic floor as not being normal.
Exactly. So I did physical therapy for a while, and I did biofeedback, and
So what did the physical therapist say when they studied your muscle?
My muscles are definitely really tight.
And are you still doing physical therapy?
No, because of COVID, we had to stop.
Okay, but are you doing the exercises she gave you?
I just reprinted them the other day because I thought I need to start doing these.
You need to start doing those. Yeah. So, I mean, if you have tight muscles, you're not going to pee normally. So you're tight.
Yeah.
So, I mean, generally, your urinary retention can be caused by multiple factors, but tight muscles is obvious number one. Number two would be having some sort of distortion of the urethra and or bladder from a bladder prolapse, like a bladder that's folded onto itself, or a bladder that is falling, a bladder that's prolapsing, or
they said I don't have the bladder. The bladder's not
fibroid tumor. You could maybe have a fibroid tumor somehow. I mean, I don't know. The thing is everybody's guessing, and I'm guessing too. And you deserve more than a guess. So one of the more interesting cases was of a woman, and I told this 2 weeks ago. She'd been dealing with symptoms for a decade or longer, but her symptoms were really specific to her urethra. And she just didn't pound the point away until finally a nurse listened to her and said, well, let's take a look at that. And so what they found is, your urethra is kind of like the size of your little finger. She had a, what do you call it? A diverticulum off of her urethra. So it's a little tiny tube connected, and it had stretched, and it was the exact length of her urethra that was filling up with urine. And because the connection was really small, it wouldn't drain out. And the cure for her was surgically removing it.
Interesting.
So,
they've never even taken a x-ray or looked at it, or
if this has been going on for a long time, why not look? I think you have the right to say, listen, I'm not quite satisfied with this. I want to know if there's something else that could be triggering this, and see if they would be willing to do that.
Yeah. I just don't want to fill these landfills full of these.
Yeah.
It's crazy. Like, I get this bag full of stuff to throw in the trash. It's just awful.
Well, yeah, and it's expensive.
It is.
It's
Yeah.
expensive, and every time
My
you do it,
insurance is fighting me, and it's $100 a month
yeah,
to get catheters.
yeah,
So,
yeah.
and I guess emotionally, that's the one of the bigger parts of this. It's just emotionally how to, like, I want to be able to urinate like a normal human being,
Yeah.
It's so
Well, the
frustrating.
other thing, how long has this been going on?
But I've started cathing maybe a year and a oh no, it's longer than that, before the pandemic. So about 2 years.
So the other thing that happens with aging is with the loss of estrogen, our muscles get weaker.
Yeah, I do use estrogen. I use
Are you
estrol,
so as a pill or as a topical?
topical.
Okay. Okay. Well, you are an anatomical mystery to be solved, and I think at this point in time it would be nice to have a better idea of what could be causing your urinary retention and estrogen atrophy, tight pelvic tight pelvic floor muscles. Is there any other structural abnormality like a urethral diverticulum? But you already have one giant clue, and the physical therapist said your muscles were wicked tight.
She said something about, like, when she was, examining me, she hit something that made my hip. I felt it in, like, she's like, that's your hip. So I don't know where to go with that, who I would even see about a hip issue.
Oh, well, you'd see an orthopedic surgeon.
Oh, really?
Yeah,
Okay.
yeah, or a physiatrist. A physiatrist is somebody who specializes in bones and muscles. And so she was able to pop your hip in some way and trigger some pretty significant discomfort in your hip.
Yeah.
Then why not
Yeah.
get that checked out too? I mean, at a minimum, an X-ray just to look and see if there's anything funky going on would be interesting, right?
Would be. Yeah. Yeah.
Yeah.
That's it.
I don't want you to be a patient. I want you to be a respite. Instead of the word patient, we like the word respite. What does that mean? A responsible participant in your medical care. In other words, you're the squeaky wheel. You have to be vocal. You have to be assertive. You have to say, this is not enough. I want more answers. Can I have a referral to another doctor?
It's just difficult because I'm a social worker and I'm
Yeah.
so burnt out. Like, it just taking care of me, huh?
Oh, girl. I mean, seriously, the stress we've all been going through this last year, well, the last 4 years, but especially the last year is between the election and COVID and fires and all that sort of stuff. It's no wonder we've gained weight, and our TMJ, at least my TMJ, has been very unhappy.
I had to get a night guard and get these teeth fixed, and
See, these are my
I got
teeth.
two. Look, I
Yeah,
got new ones too.
yeah. But my left jaw is still. I've been sleeping in a recliner for 6 weeks. And it's way better. But if I lay on my back, my left side of my jaw just goes crazy. So there's a toll to be taken for tight muscles, and stress and tension. So, but hey, listen, we've gotten this far. We're tough cookies. We're not going to give up. We're
sure.
more forceful, assertive. We know how we want to live. We know that we can fight back. We know that we're going to speak to speak whatever cause we need. We just need to be vocal and assertive and ask for help. And if they're unwilling to provide help, move on.
Yeah.
Sound good? Okay, hon.
Yep. Sounds good. It was good to see you.
Nice to see you too. Talk to you later.
Take care.
All right, Carla, honey, thank you so much for waiting. How are you today? Oh, wait, I can't hear you. Can you unmute yourself? Let's try that again. We have to. Can you?
Okay.
There
Sorry
you
about
go.
Well, thank you. I've been learning a lot just by listening to other people. So that's okay that I just gleaned more information as you were talking. So.
Awesome. Awesome. Well, what can I help you with today?
Well, it's amazing what I've learned so far. And I've been putting my history together in my mind and kind of looking at things that you've asked other people. I've had bladder urinary problems most of my life. I started out with a bad kidney infection when I was a baby.
Okay.
For that, just bladder problems. I've always had an overactive bladder, even as a kid in school,
Mhm.
you know.
Mhm.
And
Mhm.
then I was sexually molested when I was 10 years old.
Oh, I'm so sorry.
And, you know, that added to the tension,
Mhm.
hypervigilance, you know,
Right.
and lack of trust in people.
Right.
And I realized that that kind of, you know, played a big part because I was always tightened up, you
Yes.
know,
Yes.
stressed out.
Yes.
And it seems like even when my body's relaxed, my mind is going crazy. You know, just all the stuff going on.
Well,
Yeah.
that's what I was talking with Lawrence about. That is the difference between the parasympathetic nervous system and the sympathetic nervous system.
Yeah.
And when you go through trauma, so remember we were talking about bullying earlier.
Yeah.
And what the research shows that this can even happen to an adult. If you are starting a new job and there is a bully at work who is abusing you in some way, 20 days of that changes your brain for the worse. They can see your brain physically change from that
Yeah.
20 days of stress. In
Yeah.
contrast, 20 days of mind body medicine improves brain function.
Mhm.
So I'm going to guess that you have a lot of anxiety
Mhm.
and a lot of catastrophic thinking. Catastrophic thinking is just you're you're focusing on the worst possible thing that can happen.
And, you know, I'm a minister, so I'm supposed to think positive.
Yeah.
And my husband is also a minister, so he talks to me about that. And he's like, "Oh God, there you go again."
Okay. So let's think about it. So if we go back to when you were a kid, okay, you have been in fight or flight your entire life.
Exactly.
You're
Completely. And right now, my husband's unemployed, and you know, we're possibly facing eviction.
right. So
So it has not let up in
right.
my whole life. It's been
Right.
that way.
But
And
okay. So there are two fundamental steps that you've got to do. And again, if you email me, I will send you the magazine that I wrote on this, or 2 issues ago. It was last New Year's.
okay.
The first thing you have got to do is we have got to cleanse your body of adrenaline, which means we have got to get that anxiety under control. Because whenever you have an anxious thought, you're triggering fight or flight. And
Yeah.
it's through, and what's happening is it's triggering a shot of adrenaline in your bloodstream, which is just
Yeah.
amping it up.
Yeah.
And if you're like me back in the day, you're having at least 50 or 75 or 100 negative thoughts or more a day
Oh yeah.
because your brain is stuck
Yeah.
there. It's a maladaptation. So and having that high level of adrenaline circulating through your bloodstream, you can never calm down. You're just always chemically
Always,
amped
yeah.
up. So I took a anxiety class years ago that was created by a surgeon with anxiety whose son also had anxiety, and he created it for his son that completely changed my life. And you're gonna love this. So because there are two parts of it. So part number one is he explained that in many people it's all about this. We were just overwhelmed, overdosing on adrenaline. There's just so much adrenaline floating through our bloodstream. So the first thing we've got to do is we've got to render that neutral. So how do we do that? Whenever you have a negative thought, the first thing you do is visualize a stop sign. Just close your brain for a moment, stop. You just stop in your brain. Then take a nice, slow, deep breath in for 3, out for 3. And then the third step is you got to say something meaningful to yourself. Like, so, you got to remind yourself it's a thought, it has no power. So what I say to myself is, oh my God, Jill, how arrogant can you be to think that you can predict the future? You are not God. Okay. For all you know, tomorrow could be a perfect day. And so so stop sign, deep breath, minimize the thought. The most important part of that is the deep breath, because the deep breath renders the adrenaline from that negative thought chemically neutral. So you got negative thought of, let's just pick a random negative thought. Okay. I don't even need to say, okay. You think it like, okay, we're going to have a fire. Stop it, Jill. Okay. Stop sign, deep breath. Okay, I've just turned that adrenaline shot from my fire worry up, done. And then, oh my God, Jill, you're not God. You can't predict the future. For all you know, there will be no fires in your community this year. Carry hope in your heart. Okay. So they said, we have one objective in this first week. We're just trying to reduce adrenaline in your bloodstream. So when you go home, pay attention and do this. And you're going to do this hundreds of times. But just trust us. Do this. And they were right. When I left and I really paid attention to what I was thinking, I was stunned that literally every other thought was a scary thought.
Yeah.
So I did it easily 100 times the first day. The next day I was still doing it, did it about 50 times. Day after that, about 20 times. Day after that, about 10 times. By the end of the week, I was doing it once a day because I had finally gotten rid of the adrenaline, or I knew how to get rid of it. And it was a really interesting point to be at, because for the first time in years, I was calmer. I wasn't riding that adrenaline toxicity. I mean, it's not toxic, but you know what I mean. And I was shocked at how effective that was in just, and even now, when I have a negative thought, and we've had a lot of negative thoughts in the last year, that's exactly what I do. I have not had a single panic attack since I took that class. Knock on wood. Okay. So I want you to try that. Stop and see how you do. But now here's the thing that maybe you will find some comfort in. So as they were going over the mind-body medicine for people who have the chronic overlapping pain condition, so we know about tapping, we know about I Spy and other sensory exercises. Positivity was also found to be remarkably helpful at calming the brain. That when pain that is accompanied by anxiety is intensified by the brain, pain that is accompanied by laughter and or positive thoughts is minimized by the brain. And what somebody gave me right around the time that I took the class, they gave me Norman Vincent Peale's Power of Positive Thinking.
Which I have.
I am in love with Norman. He is the father, in my opinion, of the self-help movement, even though there were moments when he the core concepts of what he was talking about, I think, are vital and important concepts. That affirmations. If you speak you're giving your brain a roadmap. If you're saying, I'm going to fail, I'm going to fail, I'm going to fail, I'm going to fail, well, the odds are you're going to fail if you say that to yourself. But if you say, tomorrow is a new day, I can do all things through Christ who strengthens me. Every day in every way, my life is getting better and better. With those affirmations are stunningly powerful in kind of refocusing your brain in a positive way. Yeah. And I think that, my magazine is called The IC Optimist. 19 years ago, that was the name I picked. And I often wonder why I got better when a lot of people haven't. And I 100% believe that, man, I embrace positivity. Yeah. I live in a happy home. I have happy things around me. I wear happy clothes. You know, I just refuse to live in a dark
Yeah.
room with the
Yeah.
drapes closed in the darkness. I let the light shine in physically, mentally, and emotionally and spiritually.
Yeah.
So I would encourage you, number one, we gotta deal with the anxiety and catastrophic thinking. I think you will be a new woman in a week when you
Yeah.
get that done.
I think so too.
Mhm.
And I know this logically. It's just I need to put it into action.
Yeah, easier said than done. I want to learn all these TikTok dances, but I just watch them. I don't do them. You know, we have to be purposeful and really do things.
Yeah.
You know, um, what are your symptoms now? What are you dealing with now aside from the anxiety?
Well, I'm beginning to think that more of mine. I was diagnosed with IC, and I realized that I probably had some bladder pain syndrome probably about 20 years ago. I'm 70 now.
You are not 70. Oh my God, you do not.
Yes.
No, I look older than you do. No way.
No
way.
No, you don't.
Well, I'm 60. I'm just 10 years behind you. So,
But anyway, so a doctor here in Florida where we are, I had told him that I had a cystoscopy and it didn't show any damage inside. He said, well, that doesn't mean anything. And so he just talked about my symptoms and he said, well, it does sound like you have IC. And my main symptoms are, it's not sharp pain.
mhm.
It's dull, constant pressure on my bladder.
Okay.
And and I will say this, I've had problems with constipation.
Okay.
So I'm starting to kind of put things on the side, and it looks like it's more pelvic pain.
It sounds like it's more pelvic pain. Have you had a pelvic floor assessment?
I have an appointment later this month.
Good.
So I'm getting that done.
Good.
And I also have already set up for a therapist.
Okay, good. So, I mean, there are so there are three core fundamental things going on here. Number one, you have anxiety, and that's going to make your muscles tight. So you working on the anxiety is important. Number two, I'm gonna darn well bet that you probably have tight pelvic floor muscles. Just based upon your history, it wouldn't surprise me, and I hope you'll email me or come back into our next meeting and let us know what they find.
Yeah.
But the other thing we have to deal with is the fact that your skin is changing because you are 70.
Yeah.
The sensitivity,
I just got back on the topical
Okay.
bioidentical hormones.
Okay. That's important. I mean, that's important because when you give that skin estrogen, it plumps up and it starts producing that mucus.
Yeah.
And so that's the thing you're going to be monitoring now. You and I and everyone who has dealt with this, we're going to have to pay attention to our skin health for the rest of our life. That's not a disease.
Yeah.
It's just getting older, and it's okay.
Yeah.
We know what to do.
Yeah.
And therapeutically, if your vulva is dry and your vagina is dry, so is your urethra, so is your bladder. That's where a chondroitin-based supplement would be, aside from diet, we have to look at step one interventions according to the AUA. That's improving your water intake so you're not dehydrated. It is modifying your diet to avoid those high acidic foods. So no multivitamins unless it's a low acid multivitamin. And then number three, the AUA says try the supplements first because they don't come with the side effects that the traditional medications come from.
Yeah.
So you'd be a perfect candidate for Bladder Builder, Bladder Rest, Cysto Protect, Cysto Renew, the chondroitin-based supplements.
Yeah, I tried the aloe vera tablets,
Mm-hmm,
and they didn't really seem to help me.
I
I don't know whether they triggered like a flare or something, but I do have acid reflux. So I have to be careful about the acidity of my food.
Well, some people are intolerant to aloe. Some people are just intolerant to aloe.
Yeah.
And so aloe is just not the right choice for you. But
Yeah.
it's the chondroitin. We had a research study presented last year which showed that chondroitin was the most effective at restoring the superficial integrity of the bladder wall. And so
What
that's
is
chondroitin.
chondroitin?
Chondroitin. It's like glucosamine chondroitin that a lot of people take for arthritis. The critical
Okay.
ingredient is the chondroitin.
Okay.
And so you want to look for supplements that contain chondroitin. And
Okay.
so you've got 4 fundamental supplements that I think are the top tier supplements: Bladder Builder, Bladder Rest, Cystro Protect, or Cystro Renew.
Okay.
And the Bladder Builder I put at the top of that list because it also has the ability to reduce pain because
Oh,
of the PEA in it.
yeah. Okay.
So, but it's just a very robust, aggressive formula. If you flare with probiotics, if you flare with taking acidophilus or eating yogurt, then you would not want to do Bladder Builder. You would want to do Bladder Rest, which is a
Okay.
more cleaner, pristine. Cystro Protect has been the top dog for years. We just don't have it.
Mhm.
And it's an older formula. You know, the Bladder Builder has more methods of action. So I think the Bladder Builder is a more effective supplement. But
Okay.
some people love the Cystro Protect. So, and you probably would not want to do the Cystro Renew because that has some aloe in it, and you've had an issue with aloe. So you're kind of
Yeah,
down
what
to
was
those
that?
3. Cystro Renew has aloe in it. And you've
Oh,
already had
okay.
an issue with aloe, so we would take
Yeah.
Cystro Renew off the table for you.
Okay.
And
Okay.
again, you know, there's no way to say what's going to work. It's about trial and error, just picking one, giving it a shot, see how you do.
Yeah.
And that's, you know, that's from the American Urology Association. That's not just
Yeah.
from me, that's from the AUA, because they recognize that, like, Cystro Protect was invented by an IC researcher 20 years ago.
Hmm.
It's been used by tens of thousands of people successfully. So it is a viable option, and they could not throw out that anecdotal data from so many urologists.
Yeah.
There's just not a lot for IC, and so there's room for
Yeah.
people to try the supplements.
I've been on amitriptyline.
Yeah,
I noticed that it added to my constipation,
yes,
the dry mouth,
yes,
also gaining weight.
yes.
And my doctors wanted me to lose weight, especially with the acid reflux.
Yeah, the Elavil 20, we call it the 20 pounds. Almost everybody who goes on Elavil, also known as amitriptyline, will gain weight. I gained 20 pounds. I did it for 3 months, and it just ended up messing up my heart pretty significantly. And so I got off of it. I just was completely intolerant to all of those types of meds. So you are a mystery, and we got to get that pelvic floor assessment, and let's see what's going on. And just understand the pelvic floor physical therapy outperforms traditional bladder therapies.
That is amazing.
And
I'm so glad to hear it.
Yeah, we knew that in 2008 when a National Institutes of Health funded study proved that. The pelvic floor physical therapy is remarkably successful at reducing the symptoms of IC. And that is the moment that the IC world was flipped on its head. Because up to that point, everybody was thinking this was a bladder disease. But if it were, why would muscle therapy help?
Well, this is when I first started checking into it 20 years ago, nothing was said about pelvic floor.
No, we weren't talking about it until 2008.
Oh my gosh.
Yeah. I mean, I built the first website on IC. I can tell you we didn't talk about it back then.
Yeah.
Yeah.
Well, and the other point I was going to make is that I contacted the largest hospital here in Tampa.
Yeah.
And they had one pelvic floor physical therapist in their department.
Yeah.
And the place that I'm going now is University of South Florida. And I don't know how many they have, but they were able to get me in. The other place I had to wait 2 months to get in the door. So
I swear that let's see. Hold on a sec. I'm looking at this database here because I was just helping somebody else in Tampa.
oh,
Let me just read off some names. See, I don't know Florida that well, so let me just throw out
yeah,
some
I'd
city
ask
names.
you about Summer. That's all I know is her name is Summer, and she's at the University of South Florida.
Okay, Bonita. Just tell me if any of these are close to you within an hour. Bonita Springs, Bradenton,
No,
Coral Gables, Clearwater, Gainesville, Fort Pierce, Hollywood, Jacksonville, Miami. No, I know that's far away. Mount Dora, Palm Beach Gardens, Tallahassee. Are any of those close to you?
no.
Okay, check our. This is the Harvard database. You can check our database on
Okay.
our website too.
Okay.
Okay. All right, hun. Well, listen,
Well,
it was a
thank
pleasure.
you so much for your time and your information. I really appreciate that.
Well, you carry hope in your heart, and listen, no shame, no blame here. You haven't done anything wrong. You haven't done anything wrong. None of this is your fault. And the joy in this is that as you learn about this and as you learn about some better methods at controlling anxiety, you're just going to be that much better of a minister.
Yeah, I know that too.
Yeah.
So,
And just kind of there's the toll that stress takes on our whole body, and
yeah.
getting back and finding that spiritual comfort and peace and rest. The rest we just need, where we can just take a break from everything out there that's hammering us and find that center again. And I listened to Joel Osteen, and I know some people like him and some people don't like him, and that's okay. What I like about him is he's very modern, and he talks about stuff today. And the one I just listened to was something I really needed to hear, because it was about fighting back. That we don't have to take abuse, that we don't have to take people who are deliberately hurtful, people who in this internet society of people who send poison pen letters and things like that. And we've all gotten them, and I've gotten some doozies in the last couple of months. It talks about using your faith to fight back, that when you fight back with kindness, when you fight back with love, when you fight back with compassion, when you fight back to reclaim your purpose, you can't let other people diminish your purpose. It's important to stand strong. And I just really needed to hear that, because I think we've all gotten beaten down a lot this year. Right?
Absolutely.
Yeah. Well,
let me ask you
Yeah.
one more question. The doctor, the urologist I've been going to, wanted to do a couple of tests, including a cystoscopy, without any sedation or anesthesia. And the last time I had one like that, I was just screaming. The nurse was holding me down and the doctor was doing it. And I talk about anxiety. It was horrible.
No. The American Urology Association guidelines say that it should be an outpatient procedure. It is not meant to be done in the doctor's office anymore. The AUA guidelines for IC, they acknowledge the harm that has been done to patients in years past.
Yeah.
Like having a hydrodistension without any anesthesia in the doctor's office.
Yeah.
And their overall theme of the guidelines is to reduce trauma.
Right.
Because they admit the patients didn't go back. And one of the worst ways that you can traumatize patients is by doing a hydrodistension without anesthesia. That happened to me, And I was also screaming and sobbing my eyes out when a radiologist did it. So never again. You're the boss. They're not the boss. You're the boss. You pay them. And you're going to say flat out, I refuse to do this unless I am properly anesthetized.
Well, I'm glad I asked you about that.
Oh,
because-
it is. Yeah.
Okay.
And you know, the worst thing you can do to a hollow organ, whether it's your stomach or your bladder, is stretch it.
Yeah.
That's what triggers the pain receptors.
Yeah.
You know, and also understand that in the old days, they used to do what we call high pressure, long duration hydrodistensions. Because back then, what they did is they stretched the bladder as much as they could. They put a ton of water in it, and then they held it in there under pressure for 20, 30 minutes. And of course, bladders ruptured. And people were sent home with catheters for 2 weeks because the bladder actually kind of exploded.
Oh my God.
And so today, they're supposed to use, according to the AUA, low pressure, short duration. It's supposed to use minimal, you know, just enough to get it done, not to traumatize the bladder, not to traumatize the patient. So, but I would never, ever agree to have a hydrodistension without anesthesia. It should, in my opinion, it should always be done as an outpatient procedure with a minimum, with sedation.
Okay.
Okay.
All right.
Okay,
Thank you.
Okay, and the AUA confirms that. You can go to auanet.org, the American Urology website, and look at the guidelines for IC. And if you want to send me an email, I will send you the link to it so that you can read up on that. So that if a doctor wants to do that, you can say, hey, but the AUA says we might want to do it this way. But there's really no reason to do that now.
Okay.
It's been done. Your bladder looked normal. So the odds are your bladder is normal. The odds are it's your central nervous system and your muscles that are driving that are driving all of this for you.
Okay.
Okay.
Thank you.
Okay. Nice talking with you.
Nice talking with you too. Thank you, Jill.
You're very welcome. All right. I'm going to shut down the Zoom meeting.
Oh.
And the Zoom meeting is down. And we're going to come back to YouTube. Hello, my friends on YouTube. Norma says, please add subtitles. I didn't know that I could add real-time captions or subtitles, Norma. I will figure that out. I will figure that out. I did not know that. All right, let me look at Facebook here. JP Purtle says, can you please email me all this stuff about men? Yes, JP. Hold on. Let me write down your email address and I will, let's see, tomorrow's my day off, although I usually work in the afternoon. So let me write down your email address. John. All right, John, I will see what I can do. And listen, if I don't do it, be the squeaky wheel, call me and say, hey, you didn't send it to me. Lori says, pelvic floor physical therapy has helped me so much, but I have very tight muscles and some right side pelvic pain. I was fortunate to find a therapist who specializes this and has been doing it for 20 plus years. So Lori, whenever muscles stay tight, we always want to take a step back and look at bones, see if there's something wrong with the way you're walking, your hips, your SI joint, your knees, or your feet, which could be constantly triggering those tight muscles. Or are you going up and down a lot of stairs, right? Lauren says, do you think Wellbutrin antidepressant can cause pelvic tension? I stopped it because I felt like I was squeezing my butt a lot. Now I feel depressed. Well, let's look up the side effects. Can Wellbutrin cause pelvic floor tension? Well, let's see. Let's see. So this is from WebMD. Huh. Side effects, nausea, vomiting, dry mouth, headache, constipation, increased sweating, joint aches. That's interesting, joint aches. Sore throat, blurred vision, strange change taste in your mouth, diarrhea, dizziness. It can raise your blood pressure. Serious side effects would be chest pain, fainting, fast pounding, irregular heart rate, hearing problems, ringing in the ears, severe headache, mental mood changes, uncontrolled. It can cause uncontrolled movements, also known as a tremor, which y'all probably have seen that I do occasionally have a tremor in my neck. That's inherited. The tighter my muscles, the more my head goes like this. I don't see anything. I mean, it can, hon, I just don't know. They say you can have muscle tenderness and muscle weakness rather than tension. It could be that you're having the opposite of the effect of some medicine. Some people have the opposite reaction to what the medication is intended to do. I always forget the name of that. It starts with a P. That'll come to me. Hi, Kay. Ileana says, what is a good physical therapy? She posted a link for a good physical therapy session. That's great, Ileana. Thank you so much, hon. Hey, Ileana, I hope you're doing well. I hope life is good for you. And if you, I'm not sure if you're still in Florida, but if you are, if you ever have any recommendations for physical therapists or urologists down in Florida, gosh, we would sure appreciate them because Florida is a challenging state, very, very challenging state. All right, well, listen, so we have a giveaway. Our giveaway today is going to be two of these new heating pads. And so this is a nice square microwavable heating pad. This is a companion heating. It's not even in our store yet. They're being driven up right now to be put into our store. So this is a slightly smaller, less heavy heating pad, but it's still a really, really good heating pad. So let's do this giveaway. First of all, if there are any men out there or anybody out there who is working with men who have pelvic pain, my email address, icnetwork@mac.com. You got anybody out there, you are welcome to email me. If there's something that I can help you with, I will try. Although I try, but I get hundreds of emails, but I still try. Oh, Curtis says on YouTube, the guy who you chatted earlier with shared a lot of similarities with me. Had a hard fall on my tailbone in high school. I had bladder wall driven hypersensitivity, food sensitivity. Yeah. See, Curtis, isn't that so interesting? Now we know, now we understand the orthopedic connection to this, the trauma connection to this. And that's why I really rail at people who say, can you cure this? Because you don't cure an injury, you heal an injury. There's an assumption out there that IC is an incurable bladder disease. And when I started off this meeting, I really pointed out the fallacy of that. IC is in fact a pelvic pain syndrome. Why? Because structures outside of the bladder are often involved. And so what we try to do now is we try to do a better diagnostic examination, physical examination, to try to understand what's going on in your pelvis. And in addition to that, going back and looking at that history. Okay, so Ileana says there's a great doctor in Tampa named Raviender, last name Bucka Patnam. So for Tampa, Florida, I got to write this down. Thank you, hon. I really, really appreciate that. From Ileana. All right. I thank you so much. Thank you, hon. Thank you so much. I really appreciate that. All right. So anyway, you have to remember the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? Yes, for some of you, your symptoms began after bladder trauma from the chemotherapy, ketamine, drinking too much coffee, Mountain Dew, chronic infection, whatever. The bladder gets involved and the muscles will get tight to protect you. But I think Ileana is one of the, so Ileana owns the company that created these. This is just a lifesaver. Here, hold on. I got this window popping up. So for those of us who do have pelvic floor dysfunction, we are usually taught by our physical therapist how to do some homework. And so she created glass wands. And her company, IC Relief, has 3 different types of glass wands that can be used. And they're Pyrex glass wand. This is what I use. And these are amazing. So helpful. I mean, what's so hard here is that we need you to be independent. We don't want you to be dependent on anybody. If you're flaring and it's a Sunday and you need help, if you're having a wicked pelvic floor flare, for you to endure 24 hours of wicked where you can't pee and whatever, where if the physical therapist can teach you how to do things that will calm and relax your muscles, that is the best case scenario here. And so from you doing your guided relaxations and specific stretches to potentially doing some internal massage, these are vital. And I want to demonstrate this. So let me get out my you can see I have my knee brace on. Wish me luck on my epidural on Thursday. I have 2 ruptured discs in my back that make my right knee numb. God only knows what I'm going to be. Okay, I can't have an anxious thought. Okay, hold on. Stop sign, deep breath. Okay, Jill. It could be perfect and it could fix everything. You're not God. You can't predict the future. Okay. Okay. So here we have your pelvis. And if you look at your pelvis, look, we can see your pelvic floor muscles. And your pelvic floor muscles really stay fairly flat on the bone, right? So here's your hip bone right here. And you can see that the muscles tend to stay, they're supposed to be fairly flat and they perform a supportive role, right? You can also see from the bottom that there's no bony structure protecting them. And this is exactly why sitting on a bicycle seat can be devastating. So if I attach the levator ani muscles, so these are the shallowest muscles. So these are the muscles that were spasming after I had my hysterectomy. And what makes these muscles all the more unusual is that they're the only major muscle group in the human body that are central to bodily function, because there are 3 holes for a woman. You got a rectum, you got a vagina, and you got a urethra. Now imagine what would happen if these muscles were tight. If this muscle were tight and squeezing your rectum, guess what? It's going to be hard to have a bowel movement. If it is tight right here, guess what? It's going to be hard to have sex and enjoy sex. If your muscles are tight here, it's going to be hard to pee. You won't be able to release your urine easily because you're waiting for the muscles to relax. But there are also, Ileana says here, my mom fell and is in the hospital. I've been by her bedside since Tuesday. She bruised her tailbone. Yes, and Ileana also has a new, do I even have it? Oh, I swear I had it. Yeah, look, I think I do. Yeah, this is the first time demonstrating it. I just got this in. Ileana also has, it's called Easy Cool, and it's a cold pack that you can use down there. Okay, so let me get back here. So the other thing you got to understand about your pelvic floor is that there are 3 layers to your pelvic floor. You've got the super shallow levators, right? So these are the shallowest ones. Then you've got mid-level ones right here. And then if we look inside, look at this. You have deep ones, piriformis muscle, obturator. These are very, very deep muscles. And for me, as an example, with my pelvic floor, it is on my left side, it is this freaking muscle right here that gets super tight and it lifts off the muscle. I mean, it lifts off the bone. It makes, I can feel it. It feels like jerky. It feels like beef jerky. And obviously, if I'm laying on my back, I cannot use my finger and get in there. That is exactly why these are so good. And if I demonstrate this here, so look, see, I can use this to follow the length of the muscle. And my physical therapist kept saying, Jill, it's a J shape. And I never understood the J shape until I read the book Breaking Through Chronic Pelvic Pain 2 years ago. And now that I have this model, you can really see it. It is a J shape. Here's the base of the J, and it curves and goes up. And this is basically the key critical movement that they're going to use when they do pelvic floor work right here. Right there. See that? It is a J. It's fascinating. So for anybody who has long-term constant chronic tight muscles, and for me, it's because of my SI joint right here. That's why my muscles are tight. My SI joint's messed up. Having something like this wand is invaluable. And as soon as I start feeling my urine stream tightening up and being hesitant, I know it's time to use my wand, and I know it's time to buckle down and get back and work on those muscles. And it's at least, I'll be good for a month, and then I'll sit too long and it'll happen. What else does she say? Ileana says, easy to cool, helps to numb the pain and burning, reduce or prevent inflammation as well as flares. It's comfortable and discreet, using ice for burning and pain, also before and after an examination, vaginal ultrasound, vulvar treatment, biopsy. Boy, absolutely biopsy. Vulvar biopsies are no fun. I've had 2. Exercise, intercourse, inflammation. The general recommendation is 15 to 20 minutes per hour, and that the benefits last 1.5 to 2 hours. Corianne says, would that wand help me? My physical therapist told me the top muscles by my pubic bone are super tight every session. Yes, exactly. It could. It could. It really, really could. And you can get them in our store over on the IC Network. There's generally, there's, there are different materials that are used. Some people use dilators, other things. I personally find the glass wands the best because they are so easy to clean. They are just hygienic and super easy to use. So I am a huge fan of Ileana's work and her products. And so this one is called Easy Magic, the one with the curve, and this is the one I use. And there's also a bigger one that has a curve for people who might have a more challenge reaching the area. And there's also a straight one too. And so you could try the straight one also. Curtis, yes, you do need to have a pelvic floor exam. Absolutely. And email me, and I will email you the magazine so you can read those 2 patient stories, okay? Okay, so anyway, I got these heating pads for you. I've got heating pads for you. And so if you would like a heating pad, my email address, icnetwork@mac.com. I want you to email me your let's see, what could you email me? Your best relaxation and or anxiety management tip. Okay, so I'm going to give 2 away. If you would like a free heating pad, I think they're probably going to be in the area of $20, $22, somewhere in there. Just email me, icnetwork@mac.com, and send me your best, your favorite relaxation or stress management tip, okay? And also, if anybody wants any of the last 2 magazines, email me, and who knows, maybe I'll send you one of those too. Don't forget to give me your mailing address if you want it. I need a mailing address so I can physically mail it to you, all right? Ileana says, have you heard of the Pure Wick? No. What is the Pure Wick? Ileana, you need to come do a speech with us. We need to do an event, you and I think that would be awesome. The Pure Wick. Oh, I think I know what this is. Yeah, okay, yeah. I just heard about this. I swear I just heard about this like 2 weeks ago. It's an external female catheter called Pure Wick for people who have incontinence. And you basically tuck it between your legs, and it's pressurized, right? And it will pull urine away from your skin to a sealed canister. That's very cool. That is very, very cool. We need more, definitely. Well, all right, my friends, listen, if you found this meeting helpful, please think about donating to the IC Network, or at least becoming a member of the IC Network, where you can get our magazine called the IC Optimist. It would be, your support would be greatly appreciated. Obviously, this is free, and I'm more than happy to do it for free. I need to give you your homework. For 15 minutes a day, I need you to do something to calm your spirit, give you some peace, whatever that might be. What would give you peace? What would center you? For 15 minutes a day, I need you to do something for your bladder or your pelvic floor. Get down on your back and do your relaxation with your pelvic floor exercises. As I remind myself, I must do that too. For 15 minutes a day, I need you to do something for your noggin. It's time to read. Let's get your knowledge level up there. And come to our website, go IC Network, go to the ICA website. Better yet, go over to pelvicpainrehab.com. Honestly, their blog is insane. It is so good. And then last but not least, I need you to do 15 minutes a day of laughter, because remember, laughter modulates pain for the better. Pain that is accompanied by laughter will be minimized by the midbrain, and that is a very, very good thing. But if you're stuck in the anxiety, catastrophic thinking, you are intensifying the pain because your brain thinks your life is at stake. So let's get some laughter into your daily life. TikTok, my friends. We need to have an IC class. ICers who want to learn TikTok dances, because I swear, I want to learn all the TikTok dances. I love them. Ileana says they're using it at the hospital, but they can be purchased for home use. That is very cool. Very, very cool. All right, my friends, I'm going to call it here. We've been doing this for a little over 3 hours. Happy Mother's Day to all the mothers out there. And for those of us who are not mothers of children, but we are mothers of our animals and our parents, happy Mother's Day to you too, because mothering instinct is common regardless. And I know that you're a good mother. I wish you the best. Peace to everyone. And I'll see you next Sunday if my epidural goes okay and I can walk. Cross your fingers. Cross your fingers. And this is the new hug. Hug. All right. See you later.